All right, good morning, everybody. I'm going to go ahead and call our April meeting to order. Got a few people online joining us this morning, and then even here in the room, we've got some new faces. So we're going to go around and have Gary call the roll, and if you don't mind, go ahead and tell us just briefly who you are and what your industry segment that you represent is when Gary calls your name. Yes, that would be wonderful.
Dr. Shipman, why don't we just go around the table?
Sure. Kyle Shipman, Indiana State Veterinarian.
Brad Fisher, Fisher Meats in Portland, Indiana. I'm a licensed entity.
Dale Ragland, I am a faculty member at the Purdue College of Veterinary Medicine, and I am a Purdue representative for this board.
Larry Hopkins, I'm, I guess, one of the new kids on the block today. I'm representing the sheep industry, live halfway between Westfield and Zionsville, have a small farm. Spent most of my career in state government, but have a family dairy farm that I'm partners in and also raise sheep, and recently was elected to the American Sheep Industry Board, Executive Board, so representing the Great Lakes states.
Dimple Hall, I'm a small animal veterinarian in private practice.
Ty Hardberger, representing poultry. I work at Roseacre Farms in Seymour, Indiana.
Gary Haynes, Chief of Staff here at the Board of Animal Health, and I will call up a couple folks here online, board members, just to make sure they introduce themselves if they're on. Keith Beer. Keith, I think we almost heard you. You tried to say something, we didn't hear you. Then Dr. Abby Hafner.
Hi, good morning.
Good morning. Thank you for participating. And who are we missing? Virgil Bremer.
Present. Virgil Bramer, representing beef, Blue River Beef, raise feeder cattle. Also have a cow-calf operation with my family.
Thank you. Let's see, Dr. Hartwell's a new member, but her appointment doesn't take effect until tomorrow, so she'll be at the next meeting. Dr. Armstrong.
Yes, here. Yeah, Ashley Armstrong. I am a large animal veterinarian, private practitioner in Springville, Indiana.
All right, sorry, I was adding Dr. Gifford in the present. I'm Denise Jarrett Spears. I'm the communications director for the Board of Animal Health. Carrie Sir, I'm the director of the Poultry Inspection Division for the Board of Animal Health.
Good morning, I'm Brady Harden. I'm the deputy director of the Animal Programs Division here at BOA.
Good morning, Kelly Whirling, director of Animal Programs Division here at BOA.
I'm Mike Kopp, poultry health veterinarian, but hopefully they're not going to change my name to poultry disease veterinarian, but we're still holding to poultry health.
Shelley Chavis, I'm the District 3 field veterinarian and director of the Cervid program.
Hi, I'm Amy Pettyjohn. I'm the Chief Milk Production Supervisor for Dairy Farms.
Brittany McMahon, Director of Legal Affairs and Enforcement for BOA and the Director of the Indiana Board of Veterinary Medicine.
Jared Hagenow, Assistant Communications.
Kenitra Hendricks, I'm the Director of the Animal Seed Diagnostic Lab.
Good morning, Julia Wickard, Purdue University, College of Veterinary Medicine. I'm the Alumni Director and Constituent Liaison.
Good morning, Connor McCarthy. I'm with the Indiana State Department of Agriculture. I'm the Federal and Regulatory Affairs Coordinator.
I'm Erica Stevens. I'm a veterinary student, fourth year veterinary student at Ohio State.
Dr. Elise Lankowski, Deputy Director of Meat Poultry Inspection here at BOA.
Dustin Nelson, Meat and Poultry Inspector.
Jesse Nibbs, District 5 Field Veterinarian.
And then lastly, I'm David Harden. I'm the swine industry rep on the board. We've got a contract finishing business just located just west of here in Hendricks County. I'm your vice chair, doing my best to fill in for Dr. Bill Doig's shoes today, now that he's got an emeritus status around here. So,
Make sure you're quick about that.
I will. All right. Dr. Shipman, I think next order of business is for you to present some certificates for years of service.
Yes, absolutely. Thank you. So we'll start off with 5 years of service to Jared Hagenow. Jared is in our communications group. He's been with us for 5 years. Thanks, Jared. Next, we have, which I thought this was more than 5 years, but I guess it's not, Dr. Renee Swikowski. Renee is our Deputy Division Director of our Meat Poultry Inspection. It looks like at least 8 or 9.
To you or to her? I know.
Yes. It's like 15 for her. And then I don't believe James Wolf was able to join us, but for 10 years of service, James is in our Meat and Poultry Inspection Division. And then Dustin Ellison. Dustin, we are celebrating 20 years of service for the state of Indiana, between the Board of Animal Health and the Department of Transportation. So.
All right.
Thank you. And last but certainly not least, 30 years of service to Miss Amy Pettijohn. Amy started in the Animal Programs Division before she went to the dark side of dairy, and has been there ever since. South Africa. Congratulations.
Thank you.
Thank you for that, and for those of you that received your certificates today, thank you on behalf of the board for your dedication and years of service to Board of Animal Health. Next, we'll move on to approval of minutes from the January meeting. Hopefully everyone's had a chance to review them, either in the paper copy that was mailed out or the digital copy that was emailed to you. Did anyone have any additions or corrections to make? If not, I'd entertain a motion to approve the minutes as emailed.
So moved.
I have a second. Second from Dr. Hall. All right. Gary, whenever you're ready.
All right, we're going to do a roll call vote because we have members participating online, so I'll just read down through the names. Dr. Armstrong,
Aye.
Keith Beard, Larry Hopkins,
Aye. Not sure I can vote on it since I wasn't here, but if I can,
yes.
Virgil
Bremer,
Aye.
Dr. Hall,
Aye.
Dave Harden,
Aye.
Ty Harberger, aye. Dr. Ragland, aye. Brad Fisher, aye. And Dr. Hafner.
Aye.
All right. Thank you. Now, Dr. Shipman, I believe you're going to have a tutorial presentation about the agency and what it does for, kind of bring the new folks up to snuff and give up the rest of us that have been here a little while a bit of a refresher.
Absolutely. Yeah, please be sharing slides here shortly. So just wanted to start off and welcome our new board members. I know since it's hit between meetings, some of our previous board members it was a little unexpected to sit in some of these chairs today, but I do want to start with the fact that Dr. Doig, our previous chairman, wanted to express his thanks and appreciation both to the board members as well as our BOA team for the years of service and everything that you all have done. So we want to make sure he was able to communicate that since he left kind of between meetings, so it had been a while. So with that, we'll get kicked off with a little bit about the agency. So next slide. So with the agency, it starts off, is it the lights? Okay. Yep. So we have 3 organizations. So we have the Indiana Center for Animal Policy, which is the umbrella organization in which the Board of Animal Health, as well as the Board of Veterinary Medicine, sit under. So the Board of Animal Health is 11 members, as you all are aware. The Board of Veterinary Medicine is 7 members. Both of those, in my role as state veterinarian, I serve as the chief administrative officer to both of those boards. Both of those boards are governor appointed and politically balanced. In my role, I oversee our agency and the day-to-day operations and are able to cross-utilize the resources within the Board of Animal Health, whether that be public information, legal counsel, our veterinary expertise and support staff between the 2 boards that predominantly are the only 2 boards that interface with animals across the state of Indiana. So we saw this really as a great opportunity to collaborate and to judiciously use our resources to serve the needs of those boards. Next slide. So if you see this in the wild, those are the 3 logos. So as we generally don't sneak around the state, but oftentimes folks don't know we exist. So this is what folks would be looking for. We generally, as we're doing inspections or whatever it may be, try to make sure that we do have our identification on us because we try really hard not to catch people off guard and spend a lot of our time educating the public on what we do day in and day out. So BOA's charge as the agency is the prevention, detection, control, and eradication of infectious, contagious, and communicable diseases affecting the health of animals, as well as the processing and distribution of products derived from animals to control health hazards that may threaten public health. So emphasis there on food safety, the first part, the communicable diseases and the health of animals overall. Our 6 priorities are first is service oriented. You may have heard us say we're working to get to yes. As a regulator, this can oftentimes be a challenge, but it's something we strive to do day in and day out. It's generally easy or convenient to say no, but our team works to get to a yes, even if we do need to compromise or negotiate what that may look like. We are constituent centric, and I think that starts here at the board level. We want to make sure we are understanding and incorporating the priorities of our constituents, and so we encourage each of you to work with the constituent bases that you represent to bring that to the decisions and discussions here at the board level. So we are ensuring that we are taking action in a manner that represents the constituents across the state. We want to take common sense solutions. These are practical solutions, easy to understand and implement, making sure they're logical, but also really ensure that they're grounded in science and experience. So the team we have developed here at the Board of Animal Health, I couldn't be more prouder of as far as the boots on the ground experience and understanding the science and the why behind the decisions we're making each and every day. And we want to maintain that common sense approach so that we can work with our constituents and help them in their day-to-day businesses. Retention and recruitment. So fostering a culture that values the retention of current talent and encourages the recruitment. This is hard. This is really hard. So especially in our veterinary space, but really across the agency, really focusing in on what strategies we can implement to retain the folks and ensure people want to be here and serve our constituents across the state. Embracing innovation, right? It's easy to be a little wary of change, but we want to continue to remain national experts in animal health by embracing and implementing those new ideas and technologies as they come along. We constantly get pushed across our divisions to consider new ideas, and that's something we want to continue to foster those conversations and be willing to hear them and better, implement some of those solutions and technologies into everything we do. And then agile and inquisitive, again, adapt quickly to changes and remain attuned to the new opportunities and improvements. Whether it's highly pathogenic avian influenza or chronic wasting disease or anything else, the marketplace is changing quickly. And so we want to make sure those new opportunities that are on the horizon, we are aware of, and that we can incorporate them as they make sense into our day-to-day practices. So we have our 4 primary mission areas. We have animal health, food safety, emergency preparedness, and animal care. So these are what we strive to do day in and day out. They don't always all get 100% of our attention because that's not realistic, but most everything we do ties back to these 4 primary mission areas. Some lesser known functions of the agency include brand registrations, rendering licensing, dead animal disposal oversight, as well as livestock market licensing, hunting preserve licensing. Granted, I know the picture's not from a hunting preserve, but those fellows look quite not excited. As well as animal care facilities registration. So those animal care facilities is one of the newest registrations that have been added to our portfolio. So that's going to include animal shelters, animal care facilities, as well as humane societies, rescues, and the like. So that's the newest to the portfolio here at the Board of Animal Health. So we talked about this a little bit, but we do oftentimes have folks that can get confused. So our organizational structure, what makes us a little different than most is that we do have an 11-member board that is politically balanced and maintained that way. That is both representative of the industries that make up animal agriculture here in Indiana, as well as veterinary medicine and licensed entities. The challenge is the board's name is the same as the agency's name. So a lot of folks don't recognize that the Board of Animal Health is both a physical board and the name of an agency. So composition of the board. So like most of you are likely aware, it's an 11-member board. That's appointed by the governor. Generally, the industries nominate folks to the governor to consider for those appointments. It's a 4-year term, and for this board that can serve up to 2 consecutive terms, and we generally ask for folks to serve until their replacement is appointed. It's quarterly board meetings in January, April, July, and October. And we do have proposed dates for those, but we work at the end of each meeting to get the next meeting set before we adjourn. So the Board of Animal Health selects the state veterinarian, and they delegate the authority to the state veterinarian to run the agency. So the state veterinarian serves as the agency head. The veterinarian must be a licensed veterinarian and an accredited, USDA accredited veterinarian, have 5 years of experience. They serve a 4-year term and may be reappointed, and the state veterinarian may not be a board member. The board may delegate powers to the state veterinarian, except the supervision of the state veterinarian, conducting hearings and adopting rules. However, the board may delegate the duty to adopt provisional rules or interim rules under those statutes. So can delegate powers generally except for those 3 key pieces. So a little bit about the agency. As I said earlier, the state veterinarian is the agency head with right around 111 full-time team members. Most of them are field-based, generally consistent with veterinarians, animal health specialists, meat and poultry inspectors, and dairy inspectors. So we're about probably 80-20, 80% in the field, 20 here in our central office in Indianapolis. The rest of the folks would then be our administrative or programmatic support. Those are the ones that aren't in the field. So we do have the piece of statute there that says all employees of BOA shall be selected on a nonpartisan basis and may not be discharged for political reasons. Next slide, please. So our district veterinarians, this is oftentimes either with our animal health, animal programs division. This is the front line of defense, the face of the agency in a lot of different aspects. So we do have our 10 district field veterinarians across the state. And so one of those we are we'll be actively recruiting here shortly down in District 8. And so we nearly have a full complement. And so the way the structure works is each of our field veterinarians serves as a subject matter expert for one topic across the state. So we have 2 of our field veterinarians here today, Dr. Shelley Chavis in District 3 and Dr. Jesse Nibbs in District 5. So for example, Dr. Shelley Chavis is our cervid health coordinator So she is our expert in deer for the entire state, and then does all species in her district, whatever that may be, as well as delivering the rest of the agency mission areas. So whether that be animal care, emergency preparedness, animal health in that space. So Dr. Jessie Nibbs is new to our team, so we are still working on her subject matter expertise area, but as she gains some experience here with us, we'll continue to grow into that position and work to figure out what specialty she will have with us. So the Board of Animal Health has the option to have advisory committees. That's an opportunity for industry input. Those are directly to a board representative. It serves as a forum to debate kind of early in the process of what that rulemaking or conversations may be. And it's an avenue for feedback and information exchange. So example could be a swine advisory committee or a farm animal care, artisan dairy processors. Those are all previous advisory committees that we have had that served as another way that our constituents can provide feedback directly to the board. BOA partnerships, so acronym soup, we can have a quiz on this afterwards. So you can see there the Department of Ag at the state level, Homeland Security, Department of Health, Natural Resources, Environmental Management, as well as Purdue's colleges of Ag and Veterinary Medicine. Obviously, our partner at the Indiana ADDL Extension and State Fair. Federal agencies there, USDA, FDA, CDC, DHS, a lot of those complement the state entities. And then all of our commodity industries, and I'm not going to go through that entire list. All of them we work with. We also have a role, a direct role with the Indiana Animal Disease Diagnostic Laboratory at Purdue University, as well as SciPac down in Du Bois, Indiana. They are the official state laboratory for regulatory disease testing. And the BOA board here actually approves fee changes as well as submits the budget request for the ADDL. So you will hear from Dr. Hendricks here today on an update from the ADDL as well as a request for fee changes. So there is a direct tie in with the ADDL at Purdue. So just a 30,000-foot view of the impact animals have on Indiana and the economic activity that they support. So you can see there, dairy, nearly $12 billion in economic activity, over 56,000 jobs, swine, $3 billion, and 18,000 jobs, and poultry at 18.3 billion and 48,000 jobs. So that really leads and strengthens our national ranking. So number one in veal, number one in duck production in the country, number three in egg production, number three in turkey production, 5 in swine, and number 15 in milk. So we've been pretty consistent in those rankings for several years now. Some of the poultry ones kind of jockey back and forth with our neighboring states. So, but we've held pretty consistently there. Another common question we get is where are the animals at in the state? So you can see on the left there, a heat map of swine. I should clarify, these are farms, not quantity of animals. So swine is actually spread predominantly north of 70, with several more farms there in East Central Indiana. When we take a look at all cattle, we definitely have along the Ohio River Valley, a decent amount of cattle farms, generally beef cattle down along the Ohio River Valley, as well as veal calf raising up in Northeast Indiana. And then poultry, we predominantly see that up in Northeast Indiana, as well as East Central and Southwest Indiana. Obviously, some significant farms throughout the rest of the state. The other big thing we have with poultry that makes poultry very different than both cattle and swine, it's one of our only livestock maps that you'll see Marion County is colored in. That is due to the number of backyard flocks that we have here in Marion County. So we estimate that across the state, we have around 1,500 commercial poultry premises in the state. We generally believe we have probably somewhere in the realm of 30,000 backyard flocks across the state. And we know about one of every 3 of those. So about 30% we know where they're at. They're not required to register their premises with us, but what we have found by door knocking and doing surveillance during high-path AI. We know about a third of those, so we estimate around 30,000 backyard flocks across the state. That may give you warm and fuzzy feelings or not, but that is, it's definitely a sector that we see pretty significant growth in, is that backyard flock ownership. This is our contact information. That's our website, email address, Facebook. Please don't hesitate to reach out to any of us, either directly or through the animal health inbox that is monitored daily, and we can get a response back to you. So with that, is there any general questions about the board before we dive deeper into more of the substance of why we're here today?
Okay, well, Dr. Shipman, thank you for that refresher for some and primer for others. All right, moving on. Dr. Hendricks, you're ready. You can give us a report on the disease diagnostic lab.
I'm ready.
All right.
Good morning, everyone. You all have a printed copy in your packet. For those of you who are new, I try to give just a very brief financial update throughout the year, and then a more in-depth report in the fall when we have our year-end information. But so for this year-to-date report, showed that our sales and services are up 13%. Salary, wages, and fringes are up 4%. So I like that first number to be bigger, and it is this time, so that's good. So some general updates. I'm sure somebody might talk about HPAI later in this meeting, so I will very briefly mention, looking at this from the lab perspective and considering our staff and what they're, the extra work they're doing currently because of this outbreak. So in 2025, we were officially active for 8 months, and we performed 40,000 tests. In 2026, just looking at the first 3 months, which so far we're active, we did 22.5 thousand tests. You could do the math. That's a pretty significant, like 46% increase in the average monthly tests that our staff are performing. To kind of emphasize that increase of several weeks ago, the National Animal Health Network, they reached out to us and said, "Are you okay?" And as a result of that, we're in week 5 now of having USDA team members deployed to the ADDL, 2 helping in our molecular section and 1 in our accession to get the samples out the door. So that's been going on. So yeah, we're in week 4 of that help. So the incinerator and cooler replacement project, which I always have on the agenda, again, the incinerator replacement was completed back in October, so that's going great. It's working really well. The cooler, we've had some unexpected delays, some issues with the custom insulated panels. So our new expected completion date is now the middle of the summer, right warm. So we'll be glad to have a cooler. Hopefully have that project wrapped up. I've also mentioned a few times that we've been working with Hanover Research to do some assessment of the lab and kind of our impact on the state. And we just got our last report in. So at the next meeting, my plan is to give you a few key highlights from that. We're also going to have an advisory committee meeting at the end of this month. So those individuals will kind of get the first view of that, and then I'll bring that to the board next time. Our limbs replacement, also kind of a long-standing bullet point on my agenda. We are really close, I think, to being under contract with a second vendor. The first one did not work out well. We've moved on. So hopefully, I'm very excited. I can't tell you who it is next time. Surely that'll be under contract. We'll be moving forward with that implementation. And then we had also talked about quality management software. This is on pause because that company that we were working with doesn't currently meet the accessibility requirements. The good news is the LIMS that we're trying to lock in does. They meet all the requirements for accessibility. The other company does not, so that's on pause right now, but I hope that we will be able to move forward with them in the near future. Position updates. So we have been searching for a new head for our molecular diagnostics section, and I am happy to announce that we will be welcoming Dr. Rahul Nelly on August 3rd. He's coming to us from Iowa State, and I'm very excited. He's very interested in automation, which that hopefully will be a big game changer for our molecular lab and the efficiency and the throughput. I I hope our staff will appreciate that too, right? So really excited he's coming again in August. We were searching for a serology virology section head. So what has happened because of a staff member leaving? So what has happened there is our very own Dr. Broman, she's on our team of pathologists. She has stepped in to take over the section head duties in immunodiagnostics, serology, virology, call it both things. So that is why down below I have 2 faculty pathology positions open. And I'll come back to that. Poultry diagnostician, also, we've been searching for a long time. I was hoping to tell you who it is, but here's where I'm at. I've got all the Purdue approvals on the offer letter, and now it's being routed to him today, and he'll sign it, and then I can tell you his name next time. Also August 3rd start date, so I'm very excited that we will have someone in that role. And then we've had Dr. Lynn, one of our pathologists, retire, and then that position that opened up originally for the immunodiagnostic section head position has been rewritten, so we're currently searching for 2 pathologists to join our team. So that's kind of how that shifted around. And then I do have 1 technician position open currently in molecular, and that's because I was able to justify for your Purdue system that we needed an additional FTE in there, and that was based on our regular testing. So not considering HPAI, because that's just an outbreak, that's temporary.
Amen.
Right. So we're searching right now to get 1 additional member on that team, but again, not related to the increase for HPAI, just our regular foot increase, so that's good. But maybe we need another. We'll come back to that one day. And then that just takes me to our fees. So I have 3 pages of fee changes for you. At the top, I want to highlight there's a couple new things. So we finally are ready to launch the hemagglutination inhibition test for Mycoplasma galacticum and synoviae. That took a long time too. We are ready to rock and roll and just need those fees approved. And then the other little group being there, new tests are all related to our, mostly related to our digital pathology. We needed to figure out a way to put a price tag on some of the requests we're getting. And then we just changed up the IHC a little bit. But so that everything else is just a current test that we're requesting a slight adjustment to the fees. So I won't go line by line, but I can do my best to answer any questions you have about those.
Dr. Hendricks, question on the NIMS replacement. After it didn't work out with the first contractor, did you put the RFP out exactly as it had been, or were there things that in the interim time you realized needed to be in there that were added to?
Yeah, great question. We did not have to open the RFP again.
Okay.
We went back to another vendor we had already met with from the first round, but we have gone back with great detail, which is why I can tell you yet today we're under contract on making sure all the details are spelled out very clearly in the contract. So that we've been going back and forth with the contract. So and all of the needs should be addressed by this new vendor.
Any questions on any of the fee changes that Dr. Hendricks has brought to us?
Was there like a certain percentage across the board increase or?
No, on fees?
Yeah.
So we have not really, I would like to get there one day because that'd be a lot easier logistically to do that. But what we find is that we have to very carefully go line by line through our tests because if we increase them at all, we're going to be outside of the market, competition. So no, the short answer is no. That would be a lot easier. But we look at, increasing costs to run the test, reagents and things like that. We've been seeing about a 10% increase in our reagents year after year. So we're not increasing our fees by 10%. But we have a lot more tests on our fee schedule than what are listed here. And those are just staying the same because I think if we increased our fees at all, we would be outcompeted.
Any other questions for Dr. Hendricks about either her report or the fee schedule?
Oh, what, sorry.
Go ahead.
Okay, so, based on last year's test numbers, these fee changes, I would estimate they would increase our fee revenue by about 85,000 next year, just for context.
Fee revenue up 85,000, but how much would costs roughly?
To actually run the test? like,
Yes.
Well, again, 10% increase. I mean, I don't have like a hard number
Sure.
to give you, but, yeah.
If there's no other questions, I'll entertain a motion to approve the fee increases. Dr. Ragland moved to move forward. Second from Dr. Hall. Great.
I have questions on approval of the requested fee increases from the EDL. Dr. Armstrong.
Aye.
Keith Beer. Larry Hopkins.
Yes.
Virgil Bremer.
Aye.
Dr. Hall.
Aye.
Dave Harden.
Aye.
Ty Harberger. Aye. Dr. Ragland.
Aye.
Brad Fisher.
Aye.
And Dr. Haffner.
Aye.
All right, Dr. Hendricks, you are able to update your schedule now.
Wonderful. Thank you all.
No, thank you. We look forward with bated breath to the July report when we can hear all these names that we just
Right,
can't.
it'll be exciting.
Can't hear yet. Okay. Moving on to technical services. Denise.
All right, I have my report in the packet there. I wanted to highlight one thing. I'm going to share my screen here. Pull that up and highlight. We've actually been talking about it for quite a while, and we finally launched our veterinary practice finder dashboard, and lovingly called Find a Vet. And this is available on all three of the websites for the Center for Animal Policies, the Vet Board, and the Board of Animal Health. And we have put information out many times to practices across the state to welcome them to register. We don't charge a fee for this to either use it or to put a listing in there. And the benefit of this versus just the plain old Google search is sometimes, especially if you need on-farm services or maybe a haul-in clinic or something like that you want to bring your sheep into the clinic. It's hard to find that by just doing a general Google search and saying veterinary clinics near me. You still may end up on the phone because a lot of even the smaller solo practices often don't have their own websites. So they still end up picking up the phone quite a bit saying, hey, do you see sheep? Or do you see a llama or something specific? Or do you even serve my county if you offer mobile services? And so this helps you sort out what you want to find by county, by species. So up here at the top, you can select what you're looking for if you want haul-in livestock facility or you want a mobile clinic that'll come out and do a farm call or even a house call. We've had folks starting to sign up in there that do home euthanasia services for pets. This might be an option. Pick what county you want, or if you leave it as all, you'll get all of them, and you can also pick your species that you're interested in. Interestingly enough, we offered honeybees because that one is becoming an area where we're getting inquiries, and previously we really didn't have a lot of way to help folks, except that we kind of were just generally keeping a list when we could if we found somebody who was seeing honeybees, because when the FDA changed their requirements for drug prescriptions and requiring those, suddenly honeybee producers now need a veterinarian to get some of the essential antibiotics they need for managing their hives. So now we have those. We have about 15 in the system right now, so someone looking there. And handy enough, I had a reporter who called and was doing a story about honeybees and wanted to look up some honeybee veterinarians. I'm like, well, right there, because I can point you to them. And then also, we've got one on per sector that's asked about if you need an emergency clinic. Some of the specialty areas, of course, we don't offer all of them, but those are some that we do offer right there. So anyway, we have about 315 clinics registered in the system. The downside, we're happy to take anybody who serves Indiana animals. The downside is we do have some that are cross state lines, some clinics like come on over to, Dayton, Ohio or something like that. And our programmers, we're working with the Management Performance Hub. It's an agency here for the state who does all this data and the mapping work. That was causing some angst. We didn't know how to handle it, and they didn't want to do a national map and all that. So we're offering the out-of-state practices. All the information that we ask that's available there is listed below by state. So if you live near a border and you want to find your way across state lines, that's another way to access that information. So that's what we're offering right now. We're going to be making updates quarterly. So basically the first of the month, when January board meeting months, I'll be pulling the list of submissions and then sending those over to MPH and they'll get those uploaded. And by the way, the darkness of the counties shows the density of the practices that serve that area, not necessarily located there, but ones that the practitioners have marked that they will go there. Our goal with this is to hopefully provide an opportunity for folks to access veterinary care when they need it, and they may not be aware. They might know the local clinic that's in their small town, but they may not know that maybe they don't see the species they have, but there might be somebody right across the county line that they weren't aware of who might be able to serve them.
Denise, thank you very much. Gary.
Yes, Chairman, members of the board, just a couple of updates from my written report. Again, very happy to have Brittany on board now as our Director of Legal Affairs and Enforcement. So that was very helpful. Engaging in a lot of rulemaking, pre-rulemaking activity at the moment, so you'll see some of that later in the year. In terms of other recruiting, we're having some success getting our positions filled. It seems like every time we get close to having a full staff, we have someone retire or move on to another role. So it's always an ongoing effort. As was mentioned earlier, we will be recruiting for a veterinarian in the southern part of the state. So if you know anybody who might want to work for BOA, please let us know. The veterinary positions sometimes are the most difficult to fill. Just under our budget items, just some updates on federal funding. We continue to have success with continuing our cooperative agreements with the, I'll call it still a new administration in Washington. We've done a lot of review of those activities, but the cooperative agreements that we have here at BOA have continued to be funded, even though it might take a little while to get that done. There's been some delays, but nothing that's interfered with our operations. I mentioned there we were successful recently in getting our proper agreement for the AI response increased to continue to fund some of that activity. So those expenses continue to go in. From the General Assembly session, I think, I note to you all, and as I say in the report there, I've added general counsel to my title, but not in my title, but one of the functions that I'm currently serving is also the legislative liaison for the agency. So the kind of results of the last session that ended not too long ago, there were 4 bills that particularly that we were paying attention to that actually ended up being passed and Governor Brown signed. That's Old Act 56, dealt with veterinary licensing, essentially cleaned up some language with respect to reciprocity. So veterinarians wanting to practice in Indiana from other states clarify how they make that happen more easily. 1424, farm and homestead food sales. And this provision deals with home-based vendors. It primarily provided an exemption to the Department of Health's retail food code for folks who are selling certain items from their, making and selling certain items from their home. BOA's main interest in the bill is to make sure that the General Assembly did not either intentionally or unintentionally modify the meat inspection laws. And that did not happen, and so it's discussed in terms of meat products can be sold from the home or from the farm, or they have to be prepared and inspected as local. So there's no additional exemptions there, and that's dictated by federal law as well as state law. 1165, various animal-related matters. This bill modifies a number of different provisions in the criminal code dealing with animals. So there were a number of different changes. I'll just hit some of those just to give you a flavor. If you want more information, I can provide that. Obviously, the Board of Animal Health doesn't directly enforce that. These are criminal codes, criminal laws enforced by law enforcement. However, our staff spend a lot of time assisting law enforcement in evaluating animals that are involved in criminal cases. That's one of the functions of our district veterinarians. And so, as local officials make decisions about, getting search warrants, confiscating animals, filing charges, and so forth, our folks can be involved in those cases. A lot of those are neglect allegations or abuse, but there's also animal fighting and other items our folks can be involved with. So some of the changes in this bill, there's some changes in definitions that will could potentially change how charges are filed. For instance, the definition of neglect was changed to modify it in a way that talks about providing food and water in sufficient quantity to maintain the animal's health and normal development, and in a form that is unspoiled and contaminated, otherwise fit for consumption. It also wants to make clear that water that is frozen is not sufficient because excessive, apparently, and that's been an issue, so I wanted to clarify that. The other big item in that definition is now that there's some further clarification about animals with respect to failing to provide animal adequate bedding and adequate shelter may not be considered neglect. So that was a change from the prior law. And again, these would take effect July 1st this year. The other items that are in there's some changes to the definition of torture of an animal. So it talks about exposing an animal to heat or cold beyond the animal's tolerance based on the animal's age, health, medical condition, or physical characteristics if it results in pain, suffering, or death. And also knowingly, intentionally, or recklessly starving, dehydrating, or suffocating an animal. Considered torture. A lot of the other items in the bill dealt with enhancements to sentencing or taking it from a misdemeanor to a felony. Some of the items that can be an enhancement now talks about for neglect or some of the other items, torture or abuse. If it's committed in the presence of a minor, or neglect results in serious permanent disfigurement, unconsciousness, permanent or protracted loss or impairment, bodily member or organ, or the animal's death, that can be an enhancement. And then there's a provision in there that is attempting to get at hoarding, I think, but it talks about a person that has 10 or more animals in the person's custody, which results in failing to provide adequate food, etc., overcrowded environment, and some other items, but essentially saying that can be an enhancement based on the fact that there are a number of animals, too many animals, that results in these impacts on the animals. Some additional penalty or enhancements for injuring or killing a law enforcement animal. I think those are the main items in that bill. So, like I said, if you want more specifics on that, I can provide those to you. The last bill I want to talk about that passed, this is House Bill 1103. This is affectionately calls it the Boards and Commissions Bill. So this bill was an attempt by members of the General Assembly in cooperation with the Braun administration to reform and reduce the number of boards and commissions in the state. And so it went through a lot of different versions as it went through the session. So with respect to the Board of Animal Health, there were no proposals at any point in the session to change this board. But there were, during the session at one time, there was language that would have eliminated the State Egg Board and the State Creamery Licensing Board currently at Purdue and moved those functions to the Board of Animal Health. So we were, of course, paying attention to that. We're happy to do what the General Assembly wants. We just want to make sure that they would provide the resources so we'd be able to do that. But in the end, they did not include any of the ag-related provisions in there. There was also a provision there that we would move the state chemist's office from Purdue to the Indiana Department of Agriculture. But all of those were taken out in its place. The General Assembly created a temporary agricultural promotion and regulation task force, which is to meet between now and November or September this fall. On that task force, there's a number of different members, I think 16 total, plus 2 non-voting. It's members of the General Assembly, the Dean of the College of Ag at Purdue, the Dean of the College of Veterinary Medicine at Purdue, representatives from appointed by the governor for various agricultural groups, Farm Bureau, commodity groups, etc. And so those folks are all to get together and provide to collect information, discuss, and provide back to the General Assembly information about, and I'll just read some of these to you. Whether changing the United States Department of Agriculture into a regulatory agency compromises the department's advocacy for the industry. Number 2, whether changes are needed to the State Department of Ag or any other state entity that promotes, regulates, or provides advice concerning agriculture in Indiana. Current and future challenges and opportunities in the ag industry and the interrelationship of all agricultural state entities, including any information or regulatory gaps or overlaps between the state entities. So essentially, they're going to be evaluating how the state government interacts with the ag sector in terms of regulation, promotion, and providing recommendations back to the General Assembly. So that is, we'll keep an eye on that as it starts to meet probably the spring, summer, and then provide more information to you. Let's see what the group says. Those are the main bills that we were paying attention to in this session that ended up passing. So do you have any questions on those?
Gary, I'm sure you would have mentioned it if you had, but you haven't had the staff for the task force reach out to the agency yet and ask for any information or?
Not yet. I mean, we're obviously, we'll provide whatever. Yeah, the effort to create the original introduced version of House Bill 103 asked for all kinds of information through the administration and also through the General Assembly. So we've provided all of that as a part of that process. But this group that was newly created did not specifically ask for anything else. I'm not sure that they've been named yet, although I'm not entirely sure the status. So.
I've heard names thrown around, and I made sure I took my name out of consideration for any of those because I didn't want to give the image of conflict of interest with this board. So I got a feeling I could probably name the people for all the various commodity organizations, but I don't know which legislators that are appointed.
I think that's all happening kind of right now. Other items from our board, just I'll mention some technology items too. We're also in the process of updating our own health database. I think I mentioned that before. That's going to happen in the first quarter of this year. It's not going to happen in the second quarter as well. So we'll keep an eye on that. That's central to our office and something we've been working for years to get updated. Because the current version is basically on old architecture. So we need to update that. So we're working on that. Then one item for the new board members, I'll be sending you an email about a required ethics training. So all state employees and then also board members, which are called special state appointees, have to do an online ethics training. So the new members need to do it within the first 6 weeks of being appointed, and then every 2 years after that. So I'll send you an email with that link. It takes about 20 minutes, I think, maybe 30 at the most. So then if you have questions after you review that, I'm also the ethics officer for the agency, so direct your questions to me. So that's all I have for you today.
Okay, thank you, Gary. Any other questions for Gary? All right. With that, we'll move on. Dr. Whirling.
Well, good morning, everyone. Thank you for the opportunity to address you on behalf of the Animal Programs Division. You do have the full report provided in your read-ahead materials. I'll just highlight a couple items, kind of from a holistic overview from the division, and then I'm going to pass it off to Dr. Chavis after that, who's going to provide you with a more in-depth overview related to cervids and cervid health and some exciting developments. Maybe not the best way to put it, some developments that are occurring within the cervid world as well. So she'll be the real meat and potatoes of the presentation, but wanted to provide you with just a couple overarching things before we do that. So first of all, you did have the opportunity, or Erica had the opportunity to introduce herself. She is a fourth year veterinary student at Ohio State University, spending 2 weeks with us as a student extern. So I just wanted to give her the opportunity really quickly to address you as a board and allow her to just provide you with kind of a snapshot of the activities and items that she's been able to experience, I guess, the experiences she's had with us over the past 2 weeks. And then if she wants to provide you with kind of her plans after graduation, which she only has, like after this, she has 1 block left. So in 2 weeks, she gets to graduate, which is super exciting. So Erica, if you just want to provide the board with a quick snapshot of some of the experiences you've been able to have since you've been with us, we'd really appreciate it.
Yeah, so I've been here last week and then the beginning of this week, and I've been able to do a couple different sampling, environmental sampling for HIPATH across the board, kind of all poultry facilities. I've done a handful of welfare cases ranging from like at the shelter to going out to houses, so that's been really interesting. Got to visit a deer hunting preserve yesterday briefly. And help spend a day in the office, did some milk processing and meeting everyone. So that was really good, do some online training. So I look forward to the rest of this week and what it has to offer. And then after graduation, which is very soon and very exciting, I'll work with USDA APHIS Vet Services as a field veterinarian somewhere in the Midwest, unsure where yet.
Thank you, appreciate you. Sorry to put you on the spot, but I appreciate you taking a moment just to let the board know what types of experiences you're getting to have here, because we want to encourage the boards to continue their support of us hosting students. So thank you all for supporting us in that endeavor, because we absolutely want to be able to be a part of bringing up the next generation of regulatory veterinarians and animal health professionals. So thank you. A couple other items just to provide really quickly. Like I mentioned, just wanted to highlight, so as usual, I know I always stand up here and tell you it's been a busy quarter. I'm going to say it again, it continues to be a busy quarter. Our division, in addition to, keeping all of our regular regulatory programs and I guess control programs afloat and running day to day, all the routine stuff. We're also, of course, assisting our avian division in HIPATH avian influenza response, which I will allow them to be able to provide all the details of what that has looked like over the past quarter and over this current outbreak. But we have lots of staff moving all over the state, doing a lot of different activities. And so certainly, hopefully the report that you have provides you with the overview of what's been going on. There's just a couple items I wanted to highlight, but certainly wanted to, provide just the perspective of all the items that are occurring in the background and all the routine stuff that's happening day to day. And you can see that in the report. One thing that's new this quarter that I wanted to share with this group, we haven't had a chance to talk about this yet. There is a state disaster resiliency planning group that is kind of an interagency group across the state. All of our sister agencies are participating. It's being led by Indiana Department of Homeland Security. They have asked and invited BOA to be a part of that resiliency planning group as well. And so we joined that effort this quarter. Brandy has volunteered or been voluntold to kind of lead that effort on behalf of BOA. Thank you. And actually we were invited at the request or at the invitation of the State Department of Ag. So thank you for inviting us to that conversation to be a part of kind of that production systems cluster and be able to speak into disaster resiliency planning as it relates to animal agriculture and farmers that we impact and work with on a daily basis. So really appreciate that. We'll continue to participate in that effort moving forward. Another item I wanted to mention really briefly. We have had the opportunity over this past quarter to continue interfacing, of course, with all of our
commodity groups that we interface with. But I would be remiss if I didn't at least mention pigs as the swine health director, and so did want to just pull out a couple swine items. We did and were awarded our annual application or renewal status for pseudorabies-free status. So just to provide that to the board. Each year we are performing throughout the year baseline surveillance to provide evidence of freedom from pseudorabies in our commercial swine herds in the state. And so throughout this past year's annual routine surveillance, we tested, 1.7% of our breeding animal population, which was just under 5,000 breeding sows, and then also tested, 1,300 pigs from an average of 30 herds at several points in time throughout the year through our VQ herd on farm testing. And so just wanted to provide you with some of that information of what's going on in the background. We also, of course, test pigs for sale and exhibition as required. So there are about 1,500 pigs were tested for that reason. And then a small amount from different herds for diagnostic purposes as either, false positives happen or if there is a concern that we need to rule out rabies virus. So also had the opportunity to participate in the newly developed Swine Health Advisory Committee on behalf of Indiana Pork. And so that is not an advisory committee from the Board of Animal Health specifically, but we've been asked to sit on that board that they put together as part of the National Swine Health Strategy through National Pork Board. So really appreciate the invitation to be a part of that discussion as well. Last thing I wanted to mention related to pigs, for those who are not aware or haven't been told yet, we've talked for some time about the Certified Swine Sample Collector Program, which is was born out of the idea of the NPIP authorized agents that can test for those diseases within that program. National Pork Board this past quarter did launch a kind of a national database to be able to house the names of individuals who are rostered as certified swine sample collectors. So rather than it being only housed within the state animal health officials or the official state agencies on a more of a piecemeal situation, there is going to be a national database, kind of like PQA certification, that you can query and see if a person is rostered as a certified swine sample collector. So wanted to mention that, previously it was literally just the individual states that were keeping that information. So you'd have to reach out to every state individually, but hopefully it will be more of a one-stop shop for that information. Last thing, and I promise I'll pass it over, wanted to just mention, we have just wrapped up our distribution of the official 840 cattle tags that we received through USDA. We were allocated as a state 97,000 tags. We have completed our distribution and we're able to distribute 94,000 tags to cattle producers, market operators, veterinarians, and clinics throughout last year's funding or through the funding of that allocation for those cattle tags. So felt like that was worth mentioning because that was a bit of a large effort to make sure that those tags got into the hands of cattle producers, the veterinarians who needed them to be able to increase that traceability. So any questions for me before I pass it over to Dr. Chavis for the interesting stuff? It's up to you. Yeah. All right, thank you very much. Appreciate your attention. And I will pass it out to Dr. Chavis to provide a cervid health update.
We're doing all right on time. So Dr. Chavis is setting up. If anybody needs to take a quick bio break, go right ahead.
Bathrooms are right across the hall.
All right, I think we've worked out all the technical issues hopefully since Dr. Chavis. We will, glad to hear you tell us about service program.
And I feel bad for you guys that heard it in October, sorry. I did change it up, I mean, you're not hearing, I took some of the stuff out, but the background for some of the new people, I did add a few things. So, sorry, put in your phone while so I'm Shelley Chavis, Director of Servant Health and District 3 Field Veterinarian, which means I'm up in the northeast corner of the state around Fort Wayne for service, for regulatory duties. Okay.
There'll be a delay.
That big of a delay?
It has to go all the way through the interwebs, so.
Try it again. Sometimes it's. So don't hit it twice. Actually, we did work out on it.
Yeah, I spoke too soon.
Yeah. Yeah, I did. Hit your arrows. Okay, well, now it might. Okay. All right. So farm deer, just for those of you who are like, we have farm deer? Yes, we have farm deer, and our farm deer look exactly like our deer in the wild, so it's great. They should have tags in them. So in Indiana, as far as the guys that I've talked to, I've had reports of farm deer since the 70s, but maybe there were farm deer before that, but that was the earliest that the guys I've talked to. One guy in particular up in Huntington County, he says he has the first one. His name was Bucky. I'm assuming Bucky came from the wild, but I've never asked him, I should. When I say they're different genetics in the wild, obviously they're not that different. They look the same, but these are deer, at least the ones that we have now, that are bred and have been now for decades to have different genetics in the wild. I mean, nobody cares as much about survivability as the wild ones, so they are different genetics in the wild. The ones that we have currently behind fence are not taken from the wild, and the ones behind fence are not allowed to be go into the wild. So they are to be kept separate. And the Indiana Cervids, in case you wonder what do you do with them, they are raised for either breeding stock or to go as shooter bucks or bulls for the elk to hunting preserves. We do not have much of a slaughter market in Indiana or urine collection. We have one guy that did that for a while, but he got out of it in Velvet. So the slaughter market's mostly out west.
Real quick, Shelley.
Yes.
Just for what Dr. Chavis just said there, you'll often hear this referred to as captive cervids. So we try to use farm-raised deer or cervids because they aren't catching them anymore, and we don't want the impression that they're just going out and catching deer and putting it behind a fence. So we generally refer to this industry as a whole as farm-raised. It's a little nuanced, but it matters a lot to them. So just be mindful of that.
Yeah, and it's captive just makes it totally sound like they went and caught them out of the wild. The main diseases that we talk about from a regulatory standpoint, or that we deal with, I feel, with the industry, is chronic wasting disease, referred to as CWD, tuberculosis, brucellosis, and EHD, epizootic hemorrhagic disease. So the chronic wasting disease, for those that don't know, is a prion disease, the same family as scrapie and mad cow. Tuberculosis, bacterial, brucellosis, bacterial, and the EHD is a virus that is transmitted by the Culicoides fly, a biting midge or no-see-um. And similar to blue tongue in the same family. So I have to kind of spell that out for producers because pretty soon we've got them all confused about what we're testing every, they just get all confused, but we try to just kind of put that out there. As far as our CWD, we'll kind of start with that. We separate them by susceptibility, the different deer. And so the ones right now that we still consider to be non-susceptible, the fallow, axis, and muttjack. To be honest, the axis and muttjack are probably going to be under susceptible here eventually, but right now our rule still has them as non-susceptible. Those are required to have a premises ID to have them behind fence in the state of Indiana, and that's really it, except for also following any TB rules and ID rules. The CWD susceptible species that we primarily have in the state of Indiana are the whitetail, the elk, reindeer, red deer. That's about it. Yeah. I know somebody asked me, why don't we have any moose? I guess they don't survive very well, but we don't. So then as far as the susceptible species in the state of Indiana, they have to be in one of these programs. They either have to be in a registered program, which is the more like a pet hobby. I mean, they can be farmed, but as far as moving around, or the certified herd. And the certified herds are the ones that can move across state lines. That's the interstate program.
So there's differences between those two programs for sampling, identification, and movement restrictions. Primarily the certified herd, they have to sample anything that dies over a year of age. And then for chronic wasting disease, identification in the certified herds have to have their official and secondary ID by a year of age, or if they move off the premises before that. And then the movement restrictions. The certified herds are allowed to move interstate if they meet all the other requirements, and the registered herds do not have the qualifications to do that. As far as our farms, that just gives you an idea of the program, the two different ones. The red dots are the CWD certified herds. You can see that giant cluster up in northern Indiana, and then the green dots are our registered herds. This is where I mapped. I went ahead and put our hunting preserves up there. I don't know, 15 or 16 right now. Maybe 16 dots, but we might only have 15. I think we have another one coming. But anyhow, you can see those are kind of more spread out. So we'll talk a little bit about that. As far as numbers, our certification herds 190, which is about 7,000 head. Registered herds 45, about 1,100. Hunting preserves, okay, we're 15, sorry. Might be an extra dot on that map. And then pet herds were at 20. The pet herds we have separated out because those are not supposed to have any breeding, buying, or selling. They just have 1 deer or 2 deer. And so we don't do annual inspections on site. We do that every 3rd year for the pet herds. And those numbers just keep going down. Actually, all the numbers keep going down, except the hunting preserves have stayed pretty stable. We had at one point, see total certified herds 270. At one point, that was 345. So that has definitely been, even though we still have new guys in it, even in northern Indiana. Our herds primarily consist of white-tailed deer and elk. Other species that we have in Indiana, like I said, are the fallow. Yeah, we have a few cyca. Like the muntjac, are mostly at a zoo. Red deer, only a couple of herds. Axis, only a couple of herds. And then about 9 reindeer herds right now. Our samples, these are the same numbers from October because I haven't pulled them. It takes a little bit of work. So this is July 1st, 2024 through June 30th, 2025. The CWD sampling off the certified herds, 727. The hunting preserves, 348. That stays fairly consistent, at least it has so far. Now the 25-26, these are updated numbers for the wild, the hunting season for DNR. And that was 2,783. In the past, that number has been between 900 and 1,000, maybe 1,100. So they have significantly upped their game, primarily to try and see where it's at and kind of get a surveillance on that, so that they can let hunters know where CWD is. And if people then decide to hunt there, not hunt there, sample their deer, not sample their deer. So that's part of why they do what they do. This USGS map, you guys have seen this before in presentations. It's like my favorite map. That dark area, anyhow, the dark squares, what is that? Wyoming, Colorado out there, the dark gray, that's where it was known to exist, CWD, before the year 2000. And then you can see everywhere it's spread. This map, I don't know why, they used to be really good about updating it. I'm going to blame it on cuts. They don't have enough people, I guess. But they don't have our dots updated. So all the gray areas are counties that have a diagnosis of CWD. And you can see ours, as I'll show you later, are not on there. We have some more than that. And then the red dots are current CWD facilities that have CWD, and the yellow dots are farms and facilities that have been depopulated. This is our map we give to producers when they ask us, where can we buy from? So right now, our current rule reads that every white state is considered a CWD positive state. It means they've had a case of chronic wasting disease in the last 5 years in either wild or farm raised. And Indiana should be white, but we put this gray, I don't know why. But either way, that you can see. So right now, our current rule, you cannot buy from any of those white states. So it's very limited for where our producers can bring deer in. And we're going to save that talk for another day as far as our stuff. Anyways. Our import requirements, just to let you know, on a state level, you just have to have quarantine authority for it, some wild surveillance, there's plenty of that, and no diagnosis CWD in wild or farm cervids in the last 5 years. And then on a herd level, they have to be CWD certified in the USDA HCP, herd certification program. Be TB accredited or 2 negative TB tests 90 days apart. That's a federal requirement. And Indiana does not require, or the feds, any brucellosis testing to come in. As far as cervids imported, these are our numbers. They're a lot lower than they used to be because as you saw from the map, there's not a lot of places they can buy. The majority of these are fallow and reindeer. Like the ones in 2026 so far, those were the reindeer. The majority of that 39 in 2025 were fallow deer because the fallow deer can come from any state since they're not considered CWD susceptible. So we've had an increase in fallow in the last couple of years.
And those reindeer are generally coming in from Alaska.
Yes, Alaska. That's because they are still not, they have not had a case of chronic wasting disease, so they are still allowed to come in. And that's, they fly in these little crates, the babies from into the Indy airport. Cervids exported, you can see our numbers on that. Those are mostly whitetail, some fallow, some elk, some reindeer for the last 5 or 6 years here.
Is there a time of year when you typically export them?
Oh, the fall, yeah. Although right now, I mean, they had been too, they've been exporting a lot of some red does, if they can find somebody to take them. So yeah, red does in the spring and then mostly it's the fall, the whitetail. So our first case of chronic wasting disease was diagnosed in a wild deer in southeast LaGrange County, April 5th, 2024 was confirmed. And then we had a second case diagnosed in a wild deer in Posey County, February 13th of 2025, so opposite end of the state. That was unexpected. And was followed by cases diagnosed in 2026, started early January in Noble County, Rush County, and Franklin County. And those were from, the reason they kind of all came at once is DNR, that's when they were getting their testing in from their different partners, which I have a slide on who they're getting cases from. So those are our wild cases so far. We have 5 in the wild. And now, this is why I'm here today, we have our first case in a farmed raised deer, which was also pretty unexpected. Even USDA thought this was pretty unexpected, talking to them. So it was in a farm facility. We diagnosed it on April 3rd, 2026, in Allen County. This was a small breeding herd. When I say small, very small. He had 2 sites. He had a breeding site and then a site where he raised his bucks up, so kind of like his grower site. And there are 0 left on that buck site. He was the only buck there, so we'll get to that in a minute. So yeah, breeding site, that's considered a traceback exposed herd. There's about 18 animals. 5 of those are yearlings, just spawns from last year. And because of the time frame, which I'll show you in a minute, that the quarantine on that site could actually be released as early as March 1st, 2027. Because that the animal left March 1st of 2022. So it's a 5-year quarantine from exposure. So we're going to harvest some does off that site at the end of April, and we'll be doing some testing and sampling on that. So the animal that was positive was a 4.5-year-old buck. And he had moved to that site, like I said, March 1st of 2022. He was born into the breeding herd June of 2021. And he moved to that site with 3 other bucks, his other cohorts that he was born with. Those bucks went to Ohio in 2023, and they already had test results. They were harvested, and so they came back negative. So that was good to see. This buck started losing weight last fall, October, during rut, and the owner said he never recovered, and he just kind of got worse. And by the time the kids were like, "Boy, he doesn't look very good," he went out and looked at him and said, "Oh, it looks like he has pneumonia," and the next day he was dead. So that was February 14th of 2026. He was positive for chronic wasting disease on the lymph node and the brainstem. So in whitetail, you'll see a early infection will be like lymph node negative, lymph node positive, and brainstem negative if it hasn't gotten there yet. And this was positive on both. He was clinical. I don't know. Any sick deer looks about like a deer with chronic wasting disease, but I did ask, and this could have just been because he was weak, or it could have been because he was neurologic. It's hard to tell. He was asking his kids, and they were like, I was saying, was he kind of attacked? Did he kind of wobble? Oh yeah, he was doing that the last couple of days before he died. So we will call him, and obviously the weight loss, so we'll call him that he was clinical. So that's great to have a clinical deer on the landscape for that long. So this is DNR's map, other than the yellow star that we added. So DNR calls, and they just added, they just added Whitley and Allen. So they call that their CWD positive area because of the prevalence they suspect is up there. And the Noble County positive was a doe. So those animals are residents of that area. I don't know how they actually just, but anyhow, they call that their CWD positive area with their mapping and everything. Then they added Whitley and Allen. There are other areas they call their enhanced surveillance zone, south and southeast there, because those were bucks and nobody recognized those bucks. So they call them walk-ins. Kind of funny. But anyhow, and I don't know if they walked in, they had EHD, something terrible in that southeast area. So, you know, there's openings and then other deer make their way in, but nobody recognized them on their trail cams. So they don't know if that's really a high positive, high prevalence area, but those bucks were positive. So they will do enhanced surveillance in those areas and more sampling next year. Allen County is not a surprise for them. I mean, it's kind of a surprise in the fact that it's obviously at a high enough prevalence that buck caught it, and he had to have caught it from the wild. I don't know if I put on here, I can't remember if there's another slide on this or not, but I will tell you, so that herd, he hasn't bought anything since 2014. So he's a pretty closed herd. He had brought nothing into either site. Obviously the site the buck was on, all he did was they went from his breeding herd there. And so in my opinion, the only place he could have got it was from the wild. If you saw where his pens are, if you're familiar with Grable, Indiana, it's right along a busy road. People roads on one side, and then his whole farmyard with tons of dogs. He's got a lot of, dog breeding, birds, cages of birds, he rents out bobcats, so just a lot of activity. He said he has never seen wild deer anywhere near the pens, come up to the pens. So, but somehow that deer got positive. Detectability, this is DNR's map. I just think it's kind of a fun map. The numbers on it is if this calculates a prevalence for CWD in free-ranging deer, for which there's a 95% probability that the true prevalence falls below the number on this map. And so when you look at the different areas, you can see where they know it's going to be higher. Up in like LaGrange, 11.5. They know the prevalence is probably below that. But down here in like Knox, it's 1.2. So less chance that they really don't think, chronic wasting is there. But up in those northeast area, they knew it was coming down from Michigan, following this waterway. You can look at their maps. It's pretty interesting. But so that's kind of a fun DNR map. Sorry about the slide. My titles didn't get over their tables correctly, but just so you know, DNR tested 19 wild deer in Allen County last year. They were all negative. Since 2019, they've tested 120 wild deer. And I get this question a lot as far as where do they get their samples. So the method, they've got 5 from found dead, hunter harvested, almost 2,600. Opportunistic sample is somebody called, somebody killed it. Road killed, sick animal, targeted samples. So those are different areas, their methods of getting them. And then their collectors, ADDL, Falls State, check stations, DNR property staff, taxidermists. You can see that at 2,300. That's a huge program for them. They get $10 a head, sample that they turn in. And then USDA 145. So that's where they get it. I get a lot of people asking me, I don't know how they think people know this, but a lot of producers think that somebody went somewhere and got a positive head, and how they know this head is positive for CWD, and put it in one of their collection sites to be tested for CWD so that they would have a positive and it would hurt everybody. I'm like, no, why? And first of all, how would they know it was positive? So I just tell them DNR does not send in the samples unless they can pinpoint where that sample was taken, according to what they were told. Is there a way for somebody to sabotage the whole thing? Probably, but I am amazed at how many people think that's just going on just all the time. Now that we're finding it in our state, and I want to go look around us. Why do you think we're finding it in our state? Because we're looking a little bit more, and it was coming anyhow. A little bit on EHD in the wild. Because EHD was kind of a big thing every year almost now. But they received 1,100 reports of potential EHD cases involving 2,500 deer from 81 counties. All DNR does is confirms the presence of EHD in a county and not the total of infected animals. And so a total of 25 deer from 23 counties were tested, 17 tested positive. The HD season was pretty significant. The two main serotypes were HDV6 and 2, which are the ones in the vaccines for the farm deer. And so these two maps show the one with the numbers and the more color, the green. That just shows the number of reported ones, not how many confirmed. And then the yellow, the solid yellow is confirmed, and then the hashtag is where they were tested for EHD. In the farm surveys, we had 14 farms with positive diagnosis that was confirmed by the lab. The southeast and southwest were hardest hit in 2025. And for those of you who've been here a while, you know that changes. Although, I don't know, I feel like southeast is almost always up here. But central, we have sometimes central Indiana gets hit really hard, especially east central. But southeast and southwest last year, a few scattered farms in the north. And if you look at that DNR map, it kind of coincides with it in the wild. Just to let you know, with a positive diagnosis for EHD from the lab, they can limit their CWD testing requirements for dead to 15% of their last herd inventory instead of testing every single one that dies for farms that lose. We had some in the last couple of years, lose up to 30 deer from this disease.
I will say for EHD, DNR estimates that I think one county in southeast Indiana in the past 5 years, just from EHD alone, lost about 75% of their wild deer through one swing of EHD going through that county. So it can hit the farmed herds really hard, but also the wild deer pretty significantly. And if it's a really heavy EHD heavy year, we'll start seeing it in domestic livestock as well, including cattle. But we see it brewing in the deer first before it starts hopping over to cattle.
Will the cattle get it from the biting midge, or will we?
Yeah, from the fish. Yeah, so usually there's just enough midges in the area that everyone starts getting it. But yeah, it does seem like the deer will succumb first before we start then seeing it kind of spill over.
Yeah, and it harbors over year to year. I listened to a talk on that when I was at the National Deer Farmers meeting, and they were talking about it. They're also talking about when they do it, because the farm guys, they do a lot of spraying for the midges, and they're spraying surface level, and during the hours, some of the daytime hours, or if they, I'm trying to remember, with the dusk to dawn, some of the hours were when they spray, they actually show those midges are up in the treetop. I'd never heard that before. I thought that was kind of interesting. I'm like, okay, your spray's not even hitting them. Nationally, for you guys that were here in October, that 16, if you guys remember, that number was 36 from October to October. Since October of 25, we've already had 16 new farm surveyed herds test positive for CWD. We actually, I don't know, yeah, it might be on there. I added Indiana, but that might be 17 with Indiana. The majority of these herds were not in the USDA herd certification program. Ours was. Actually, of that 16, only 3 were HCP certified. And this was primarily whitetail. There might have been, there's one axis and a little bit of elk scattered in there, but primarily whitetail. White animal test, you guys have heard this before. The only thing I want to say on this is the blood test. They're getting close. It's an mRNA technology, and it's showing really good potential for being a really sensitive early diagnostic test for CWD for blood. So that could be a game changer. So we're excited about that. And just quickly, because I want to update you on our predictive genetics, Dr. Chris Seabury has been the lead for that for Texas A&M. The group of alleles that can help predict the response of a white-tailed deer exposed to chronic wasting disease. Some alleles they found to be more protective than others, and their little 50,000 SNP that they do. He gets a genomically estimated breeding value, a GBV, when they send in their tissue, usually ear tissue. And the more negative the value, the more resistant the deer is to developing CWD if exposed to it. This is a map that Dr. Seabury has, or graph that he has developed, and this could change over time. But a starting point for a herd, he says, with CWD resistant genetics is negative 0.056, which is where the blue arrow is. So you can see their susceptibility goes down from there. There'll be more on this later, but so the selective breeding is to reduce the highly susceptible variants introduce animals with less susceptible variants, and reducing CWD prevalence, and a way to manage for CWD. So here's our money that's been awarded through USDA cooperative agreements for this testing. 2023, we did 2,483 tests, 70 participants. 2024, we were awarded 181,000 and did 1,954 tests with 77 participants. And in 2025, I just have to say, I just kind of found this to be funny, but it was a competitive in 23 and 24. You could apply for as much as 250,000, and that's how much we got. Then when it wasn't competitive in 2025, we were awarded 313. I'm not sure what that says, but anyhow, that we were happy with that. They looked at past performance and what we've done. And so we were approved for 3,237 tests. We had 69 participants apply, and so that is ongoing right now to see how much of that is used. But we've been having very good participation in that. So these guys, I mean, you saw the map. Those guys in northern Indiana, if they don't get resistant deer, they're not going to have deer. So they understand that. They're working hard. Just like quickly, there are multiple strains of CWD in Indiana. They require conformational stability assays to differentiate them. But Dr. Nichols with USDA says it doesn't really matter, they're all infectious. So ours, because of the area it was in, a little bit unexpected, USDA did request that NVSL send the tissues for DNA matching from an unexpected location in a new case. So we'll see what comes back from that. See, I was quicker this time. Any questions on where we're at with our positive, our new positive in farm deer? Oh, the other thing I did want to mention, the thing that you also need to understand is, so there were, I don't remember the total number, but the herds that are within especially a 15 miles of a positive, they're significantly hurt because of they lose their out-of-state market. Now, even though we don't quarantine them, we don't put movement restrictions on them, the other states do it for us. So we had two very big herds, close to 200 deer, not 200 deer, next to this positive herd. And this producer, he wasn't that concerned about him, but he was so upset about this. I mean, these are all guys that have raised deer since the early 2000s together. And so he was so upset because he knew what that was going to do to the market. I mean, the one producer, I mean, he just sold a doe to Ohio for 70,000. And so now he has no state that will take his deer. He usually sells about 50 bucks every fall, between 15 to 20,000 a piece, and he has no more. So it really significantly hurt that guy. Like, it is his mission in life now to get those other states to change their rules. So that's really frustrating for them. That's where we're at. More to follow on changing rules, right, Dr. Shipman?
Much more to follow. The Indiana industry has expressed an interest to change the Indiana rules that prohibit moving deer into the state if the state that they come from has diagnosed CWD in the last 5 years. So they would really like to change that, and so we're taking a look at that.
And part of it, I think probably 80% of it, for most of the producers, it's a reciprocal thing. Like, they honestly believe, these, especially Ohio, these other states are watching what Indiana does. So they want us to kind of take the lead in hopes that the other states will follow. Since we've been closed, I mean, we've been really strict that if we change ours, but it's going to involve, only bringing in really resistant deer for breeding. Bucks if they get shot. We're to follow that. We're working through it.
That would be a rule change proposal for this board to make that decision. But right now, we're putting together thoughts and draft ideas for the industry to comment on. So we haven't released that yet. Our timeline got pushed back a little bit.
Good. All right, Dr. Chapis, thank you very much. We'll move along to the Avian Division report. I'm assuming Dr. Kopp, who's going to?
No, Dr. Cooper's next.
Is she?
Oh, I need to stop.
Oh, is she online? Okay.
I am here. Can you hear me okay?
Yes, we can. Thank you.
Well, good afternoon, or I guess it's still morning. Hey, Denise, the share button is grayed out.
How is it now?
Perfect.
Okay.
How does that look?
Good.
Perfect. All right. Well, I apologize that I can't be there in person. I had a mishap with a tire this morning with a screw in it and could not successfully get it to hold air. And I don't know how to patch a tire, and neither did my neighbor, besides perhaps some silly putty. So I am here at home, which is probably also better because I've been having some vertigo. So probably not safe to drive anyways. So apologies that I can't join you there. There's many of you that I wanted to see that I haven't had a chance to for a while. But as the avian division report this quarter, primarily again focusing on avian influenza, because that's been about all that we've had time to do, aside from urgent or necessary NPIP duties that we share with the ISPA. So just to get started, to go over where we are on a national stage. Overall, from the 2020 start in 2022, so this whole 2022 to 2026 avian influenza outbreak across the country, there have been almost 2,200 cases, about half and half with commercial and backyard in terms of that division. All 50 states have been affected, plus Puerto Rico. And this quarter, we reached over 200 million birds affected, either from succumbing to the disease or needing to be depopulated. So significant milestone, not one that any of us wanted to pass. And then to the right there is a map showing the situation of the past 30 days as of 4/8. So basically the month prior to 4/8. There were 46 cases diagnosed across 12 states. I think 5 of those had commercial findings, and during that time, 1.82 million birds affected. Of course, we are highlighted there in the darkest blue from the number of cases that we've experienced. Well, now it won't advance. Okay. There we go. So back here at home, what we're looking at since our first diagnosis in the fall, which was October 9th. So October through today, we've had 135 cases of highly pathogenic avian influenza. 78 of those cases have been in ducks. A lot of those were duck breeders as well as meat ducks. Layers, there have been 48 cases. 2 of those were pullets. The rest were all layers. 4 turkey cases. 1 of those were turkey breeders. The rest were commercial meat turkeys. And then 2 broiler cases and 3 backyard flocks. That has been across 12 Indiana counties, and at this point, 1.84 million birds affected, which is a number that I like for people to keep in perspective, because while we've had 135 cases and they've been, devastating and have affected these companies tremendously, the overall number of birds that were affected, I mean, that could easily have been, 1 layer complex or, pullet complex or something like that. So these are largely, 20,000 to 30,000 bird layer facilities that we have up north in Elkhart and LaGrange in particular. And then the ducks anywhere from, 2,500 to 15,000, just depending on barn type or production type. So, and that's also been spread across 13 commercial companies. These charts we receive every Friday. All the state veterinarians' offices receive these every Friday to kind of see what were the new cases for the week, what states were they in, and then dividing them up by WOA poultry versus WOA non-poultry, which you might remember. That's the World Organization for Animal Health, and it's how they define poultry So it's confusing to people sometimes when you hear non-poultry. That just means basically that they're backyard hobby or exhibition flocks, or flocks that don't really participate in commerce by selling birds or eggs or other products. So while they have distinct definitions from commercial and backyard, you can generally just think of them as commercial versus backyard. So you can see that the chart, and Dr. Kopp pulled these for us, but the chart that we received back on January 3rd, if you look at total cases by state, we ranked 23rd. So we weren't, really high up there and among the states that had numerous cases. Unfortunately, as of April 10th, we now rank second nationally in terms of the number of cases. So this is also not at all where we wanted to see ourselves, but unfortunately we found ourselves in this situation. We're almost, in terms of the WOA poultry, or what you can think about as commercial flocks, we're very close to passing Minnesota. I think they have 168 and we have 166 or something like that. And so, yes, that is correct. It's right in front of me. Sorry. So, we're close to being first in that commercial sector, which again, not great news. And then at the bottom there, you can see totals from the other states. There's kind of a top 5, and then everyone else has less than 80. So in terms of our fall outbreak until today, this is kind of a snapshot of what our response progress looks like. So 100% of the farms have been depopulated. Generally, I would, and I don't have the exact number, I'm not sure that we've looked at this statistically, but most farms are depopulated same day or next day. We've had a few cases that do go into a 3rd day, and maybe one that went into a 4th day at one point, but largely these are same day or next day depopulations, even when a company has 2 or 3 to do in the span of those couple of days. Disposal is complete at 98%. I would venture to guess, or I know at least 2 of those, probably 3 farms, it's due to manure. So disposal is not complete until manure is also moved off. Poor Dr. Whirling, I can't see her face, but she has spent more of her life talking about manure and making decisions about manure than any one person should have to do. But yeah, manure is often the challenge. It's not so hard oftentimes to get the birds either buried or backed up to the landfill or composted, but the amount of manure and how to handle it can become a real challenge. And we've tried to get creative, but there still just are some challenges. So I know at least 2 of those farms, it's very much manure based. The last one maybe as well, I'm not sure. In terms of the number of farms that have been cleaned, disinfected, and environmental sampled, we're right around 80%. Kudos to Brandy Harden for all of the arrangements for that environmental sampling. That takes a lot of teams, and sometimes they'll sample, 10 farms in a day, maybe more. So the crew, going farm to farm, that's a lot of changing in and out of PPE and so forth. So I know they did a lot of farms yesterday. So each barn gets around 250 swab sites sampled. So it is quite the task. Approved to restock, about 2/3 of these farms have been approved to restock at this point, and just over half have chosen to do so. In terms of, besides the infected farms, the affected farms that are tied up in control areas or subject to surveillance or permitting requirements, right now we have 507 commercial farms quarantined across the state, the majority, of course, in Elkhart and LaGrange counties. And again, when they're under quarantine, that means basically any movement of birds, eggs, or manure onto or off of that premises has to be permitted. And there are a lot of permit requirements depending on the product or the bird being moved. In terms of, so the control area that are those 507 farms are in, that's the first 6.2 miles which is 10 kilometers from a positive premises. And then we put an extra 10 kilometers, so out to the 20-kilometer mark, which is about 12.4, is a surveillance zone that a proportion of those farms have to be surveilled every 2 weeks. So total farms in both the control areas and surveillance zones in Indiana right now, there's 747. Movement permits that have been generated since the first week of October are almost 10,100. The BCAP audits that Chelsea Leatherman and Dr. Kopp worked to complete, those are the both paper and either virtual or in-person biosecurity audits on farms that either allow a producer or company to place birds into a buffer zone and still be eligible for indemnity. So they have to have one of those audits first, or for infected premises after they're cleaned up and prior to being allowed to restock, they also have to pass one of these biosecurity compliance audit program audits. So since October, 399 total. Like I said, Mike and Chelsea spend most of their lives doing just that. And Dr. Trainer does the restocking audits, which are the ones that are in person for those previously affected farms. And then, and I should mention, so since the beginning of 2025, because we also had a January to April outbreak, of course, the total BCAP audits then is right at 500. So lots of those. And I should mention that those audits are only good for 6 months, which is something that we've been, I think I can speak for the group, displeased with. We'd rather them be good at least for a year, perhaps maybe longer, but they're only good for 6 months. So as you can imagine, there was initially a very heavy load of these audits to do as producers wanted to place birds into buffer zones, which is part of the control area. And especially with the amount of meat birds we have up north between the ducks and the broilers, those birds go to slaughter, ducks 30 to 35 days and broilers 40 to 42 days. So they're constantly turning over. They raise, any given producer raises multiple flocks per year. And so that means they're placing multiple times per year, and therefore need one of those BCAP audits. So essentially, Mike and Chelsea are starting over, unfortunately, as we've reached our 6-month expiration on these BCAP audits. And so just a very trying and labor-intensive process for our team, and certainly for the companies and the growers to an extent as well. As I think I've mentioned in previous reports, we are sampling dairies that are around infected poultry premises. So right now we have a total of 84 that have been under surveillance, and many of those have been tested multiple times at this point. I don't have the counts, but I know multiple times. And so just to continue to make sure that this virus is not going to spill over into dairy herds, the genotype of our particular virus, which is called D1.1, I thought perhaps had a lesser propensity to infect dairy from the standpoint that we have tons of dairies up in our region where we have tons of poultry. So, and some of those residing on the same farm. And so we were concerned that there would be a spillover event, and there has been a spillover, multiple spillover events, 2 or 3, of this D1.1 genotype in other states into their dairy herds. So we continue to do surveillance for that purpose. So I mentioned the BCAP audits, the biosecurity compliance audit program. There are other audits. So these are all USDA, programs. So they came out with 3 different biosecurity audits. One is a wildlife biosecurity audit. that looks looks at a property and determines where the risk factors are and what improvements need to be made to keep wildlife out of barns, to not attract wildlife, whether that's through standing water or not cleaning up feed bin pads, those types of things. But they see and notice these folks that conduct these audits are more trained in wildlife than much of our staff, and so they see things and notice things that we wouldn't necessarily notice related to wildlife, how they may gain access to facilities, what their normal behaviors are, where they may hang out at, those types of things. So there's those audits, and then there's the BCAP audits that we do for those placements into zones as well as previously infected farms. And then the BCAP audit gets a different name when it's voluntary, which are the BIFA audits. They use the same audit tool, so it's basically the same thing. It's just producers choosing voluntarily to do these assessments as part of their prevention and preparedness for AI and other diseases. So in terms of the wildlife biosecurity audits, we've done 147 of them in Indiana, or that many have been conducted in Indiana. I don't want to say that we've done them because BOA does not do those. And nationally, that we rank 4th in terms of how many we've conducted. The BCAPs and the BIFAs, we combined have done 468 of them, and that's 34% of those that have been conducted nationwide. So we're definitely ranked first in the number of those that have been conducted in Indiana. And then all audits, so the wildlife and the 2 domestic biosecurity audits, we've done 615, which is 19% of those conducted across the country. Again, still ranking first nationally in how many we've done. So I stole this slide from Mia Torchetti and USDA NBSL. So don't get too tied up in all of the details, but essentially just look to the right, the illustration on the right. That is the part of the phylogenetic tree of this D1.1 genotype. And what we found out not all that long ago is we actually have had essentially 2 outbreaks, 2 introductions of very different strains. So we knew, and I'm speaking in particular about our Elkhart and LaGrange cases, which we've seen a tremendous amount of lateral spread, whether that's through, wind, as we suspect is occurring to an extent through, dust and feathers and droplets and that kind of stuff facilitated by wind. Or it could be, movement through people and equipment, etc. So we knew that there was lateral transmission occurring, and we knew that everything that we had had since October was this D1.1, but we didn't realize until recently that they were completely different. So one was introduced with our first case on October 9th, and then the last time that we diagnosed that same strain in Indiana was December 31st, I believe. And so we actually eradicated it from Indiana at that point. Now, we did spread. There was one case in New York in the live bird markets out there, which did show that our strain showed up there. We've had numerous movements from northern Indiana out to the live bird markets as from spent hens from the free range and organic layer operations up there. So we had tons of movements out there. They're very strict in their requirements and the timing of the testing and how many tubes they have to take. And so everything went out there legally to our knowledge, but they weren't able to identify the exact flock that it came from, since it was hauled with a few groups at a time. But definitely made it out there. And that was kind of a punch to the gut because, of course, our goal is always to keep the virus in Indiana and not spread it to any neighbors. But that was the one instance that we're aware of that has been sequenced that showed that our strain made it out to a different location. So basically then we didn't have another detection until February 11th, I believe, and that was a completely different strain. So you can see on this phylogenetic illustration, the blue arrow is pointing to basically our fall outbreak, and the pink arrow is pointing to our, spring outbreak that started mid-February. So clearly very different strains. So we essentially just got unlucky, I guess, to have two outbreaks that really, it was kind of, it wasn't very distinct and kind of gray as to, we thought they were all meshed together, that we just had one giant outbreak. The epi curve is actually pretty illustrative in terms of kind of having two outbreaks. So I say that we had a fall mountain and a spring hill, and I hope that it stays at a hill and that we're at the end of that hill. But you'll notice the cases, and I'm not sure I can point. Are you able to see my mouse?
Yes.
Yes.
Okay, awesome. So these two cases right here, they represented two cases that were actually true reinfections. So farms that we believed had eliminated the virus, had went through all the steps. We didn't pick up anything on environmental sampling. And then they restocked and got infected with the exact same virus that they were infected with the first time. So we know that it was the same one on that site based on the identical genomics. And so those two cases were reinfections. So if you removed those, we basically had a 6-week break that we didn't realize that we had, essentially, between these outbreaks that were, so you can see it's pretty distinct. Because of the continued spread that we were having in northern Indiana, in Elkhart-LaGrange, and there were a few Noble County cases, but that those haven't happened for quite some time. So up in Elkhart and LaGrange, we instituted a handful of new policies about a month ago. So one of them was power washing the outsides of barns, especially focusing on ventilation systems, in order to reach what we consider, or what the USDA defines as, initial virus elimination, which what that is basically after a farm is diagnosed as positive, they depop. At that point, it's kind of like an outdoor cleanup. So any equipment that was used in the depop needs to be cleaned and disinfected. Any trash or PPE around the farm needs to be collected and disposed of. They refresh bait stations for rodents. And so generally kind of that's the extent of it. There's not been a requirement to do any washing of the outside of barns. And when you think about initial virus elimination, it's really to prevent community spread. And so, spread to neighbors is kind of the purpose of, preventing that spread is the purpose of initial virus elimination. The inside of the barn, is then handled next as part of the full virus elimination or cleaning and disinfection on the farm. But in order to reach IVE, we instituted this power washing, and we did this partially because other states we're aware of have done it. And so we were getting essentially to almost a desperate stage, because honestly, we feel like wind does play a fair amount of a role in this outbreak. And so we're looking for anything that we can institute that we think may help. And so the idea is any virus that may have exteriorized, especially out of ventilation systems, to the outside of the barn, whether it's caught in dirt or mildew, or it's just electrostatically attached or in dust on the barn. The idea is that power washing would essentially water it down and either disinfect it and consider it inactive virus, or at least water it down to the ground and hope that there's a lesser extent that it would blow off the buildings to the next barn. We extended the post-disinfection fallow period from 14 to 28 days. So generally after a farm disinfects, there's just a couple of week time period. That's when we normally conduct the environmental sampling and get them restocking approval at the end of those 14 days. We extended that to 28 days for those counties. We also required that for the BCAP audit that we do for the purpose of restocking, that the grower has to be present. So on a number of these audits, they're during the day, and, producers may have full-time jobs, and often do have full-time jobs elsewhere. And so they're not home during the day. And therefore it's usually the company representatives, either the live ops folks or a flock technician or something, goes out to the farm and helps conduct these BCOP audits with our crew. The idea here is that the growers must be present so they see the types of things that we're looking at and commenting on. And also it gives them an opportunity to demonstrate to us that they actually do understand, particularly line of separation biosecurity. So we actually observe them generally doing most all of them do Danish entry, if you're familiar with that. So we make sure that they understand the concept of sitting on a bench and leaving their dirty shoes and clothes on one side and spinning over and getting clean PPE on the other side, or clean clothing. So, I just making sure that they all fully understand that and can do it appropriately. Infected zone placements. So infected zone is part of the control area. It's the first 3 kilometers, which is 1.86 miles. We basically said, for all intents and purposes, that those farms are all going to be all in, all out. And so basically no multi-age placements. So if they normally raise multi-ages of birds on a single premises, they're only allowed to keep one age at a time, more or less, as we're not allowing placements of birds onto farms where poultry already exist. That affected and is affecting our duck industry most extensively, because they're the ones who do the most multi-age growing, and it's extremely common to have multi-ages. So, and then in the buffer zone, which is the rest of the remaining section of the control area, so out to 10 kilometers, so that next 7 kilometers after the infected zone, we are saying if you're going to place on multi-age premises, the destination flock, or the flock that already exists on the farm, needs to be tested within 1 calendar day of placing new birds there, essentially to prevent adding birds to birds that could potentially be infected and shedding and just not quite showing the clinical signs that we know to look for, which ducks in particular are known for shedding high volumes in the earliest stages of their infection. To end on a good note, I will say it's been 10 days without a case, and that has been much to our pleasure and our sleeping habits. So our staff has been able to catch up on a few things. It's funny how many text messages I get from people suggesting, oh gosh, what are you doing with all your free time? And it's, I think we have to remind them, we had 135 farms to get to the finish line for restocking. Now, granted, I think maybe 45 of those are all that's left to be restocked, but it's still a mountain of work. And we continue to be very busy closing out all these cases. And again, we hope we've already reached the end of that hill. Contact information for Mike and Chelsea and I as part of the avian division. As Dr. Whirling mentioned earlier, though, the animal programs division is doing a significant amount of this work. So we're all, and certainly help also from our dairy division. So it's really an all agency response. We're just giving the report. So happy to take any questions from folks.
Any questions for Dr. Cooper? Comments?
Again, I just want to, sorry, Dr. Kopp, go ahead.
No, go.
Again, I just want to say a big thank you to all the staff. I mean, all the different species, and now we're focusing, this quarter on birds, ducks, everything, and all the in between. And deal with all the frustrations of another infection and just when you think you have some time, it's not a one shift job, right? So, but our sincere gratitude from the poultry industry to everybody dealing with this. And I just know first case that Indiana is far and above anybody else because we deal with other states and where we will get a heads up with a text message, you know, different hours of the night. And, you know, sometimes text messages may end at 9 p.m. and then another one at 1 a.m. You know, there's not much sleep there where I'm going at. Where other states, you'll find out an area is one of those zones after it's been infected. You know, it's just, the timing is just terrible. You know, it's like, we're all in this together, you know, help us, help you, and these other states type of thing, and help us to avoid the area. You know, they don't realize there's transport trucks hauling product, there's workers, there's crews, there's feed trucks, you know, ingredients coming in to feed mills and all that. It's like, give us a heads up so we can avoid this area. And all those frustrations the other states, I mean, we get the timely notifications ahead of time. And, you know, when you're hauling stuff, mistakes happen. We were appreciative. We heard that there was a dumpster turned over. We got with our transport department, hey, avoid this area in case there's any trucks with eggs going in that area. So just kudos to everybody. Deep gratitude, deep thanks. Really, really appreciate it. Can't say it enough.
Yeah, no, we appreciate that. And I do want to add one thing before COP goes. Regarding BCAP audits, right? And maybe you're going to allude to this. Okay, so as Dr. Cooper alluded to, right, BCAP audits are taking a pretty significant amount of time. You know, we're leading the country in the number that have been completed, and there's a large discussion at the national level on the utility and effectiveness of these BCAP audits. You know, what some desires to potentially push out the length of time that these would be valid for. A lot of that has to do with the fact of how much time these audits take, right? So, you know, Mike and Chelsea are spending all of their time, all of it, and then some, doing BCAP audits. Dr. Trainer is spending a significant amount of his time doing the restocking portions of that as well. But we have to take a step back and recognize that these only came into place December 30th of 2024, right? So this was not a requirement prior to December 30th, 2024. So this is a new expectation, a new requirement by USDA that is significantly impacting the amount of resources it takes for a state to respond to influenza and to keep up with the business continuity portion of the response. So, right, this is predominantly negative farms that we're doing these audits for. Yes, a portion of it is previously impacted farms, but just keep that in mind that, you know, prior to 2020, late 2024, this wasn't being done, and that's good, bad, or otherwise. But that's a significant resource allotment that we've had to put towards these to maintain that level of operation and be compliant with USDA because they watch very closely in this space. So I just wanted to add that piece of perspective that it's taking a lot of resources to get those BCAPs done. A lot of resources to do the whole response, but that's a new piece that we hadn't had to allocate resources to prior to really our incident in early 2025.
I just wanted to follow up on Ty's comments too, to just thank the staff and let the board know what kind of staff you have at the Board of Animal Health. I mean, it's been unbelievable when you look at when we started just a year ago in the start of 2025. And then we basically went, you know, we've gone from that 18 cases to the 163 type additional. So we had a 900% increase. No other state in this short period of time has experienced anything like that from that standpoint. So our staff has been doing a fantastic job out there because it went basically 5 months in the spring when you look at from the first non-negative to the quarantine release. So we had a little time off in June, July, and August. September. And you generally, high path AI for the newer board members too, you don't really see it till late December, January. And some of the predictions was, oh, we're gonna see it earlier this year in 2025, and it started in Indiana in October. And so now we've been going 7 months straight, 185 days straight. And you think about this staff, and what amazes me is especially, and Randy leads up our administrative staff. We have our office staff back there that normally sits in front of their computers doing all the paperwork, and they go out there and do the environmental sampling. So they leave here, go up to northern Indiana, stay overnight, away from their families, everything else, and they're out there putting their Tyvek suits on. And swatted birds, it's amazing me, the support we get. You see me get emotional. Because I do this, because obviously I'm in the poultry industry and everything else, but to see the staff response, and we know, you guys know that from a livestock production standpoint, it's a 24/7 job. And we have our district vets, don't care what day or time, because USDA wants those birds down in 24 to 48 hours. So we go, it doesn't matter. And the lab's there every time, they're running those samples till midnight or anything else, and we gotta get those samples. Then our field staff responds, and the rest of the people go out there. So it's been amazing when you think of the 16 months that we've been doing this for a year straight. 75% of our 16 months, we've been doing this. So we hope as Dr. Cooper says, that hill's over, and we don't have that hill come back, but it's just amazing the staff you have assembled here on the State Veterinarian to do this kind of work, because again, trying to keep up with our industry and support them versus what we see in other states. A lot of them, I don't want to say this, throw up their hands and say, I'll let the feds come in and do it, and then materials. But we have very dedicated staff. They want to serve our Indiana producers with the timeliness of getting them back in. So, again, thank the industry too, because they've been hanging with us for that long too, and tolerating. So
well, it's been unprecedented. High path AI typically over the decades, been every 5 to 7 years. You kind of watch the migratory birds around the world, see where it's happening, kind of predict what's going to happen here. Now, 5 to 7 years, you get either a hiccup or a big event, and then, fall, winter, then spring, and the summer heat takes it away. It's been the H5N5 since February 2022. H5N1 since 2022.
Right.
And every year, and even summer events too. So it's been an unprecedented time dealing with this.
And for our new board members, in case you really want to know everything that happens in the bird flu world, we do have our email updates that you can subscribe via our website. So that email goes out every time we have a new case. And generally, just for perspective, right, that generally goes out within 1 to 3 hours of a detection out of Indiana ADDL. So those are close to real near-time notifications of additional cases throughout the state. So if you're interested, they might already be getting them.
They will be getting.
They will be. You'll be getting them. So.
Yeah. One more thing for your inbox.
Yep.
Dr. Cooper, this is David Harden. I want to apologize that I didn't see you were online. I just knew you weren't in the room when your segment started off. I've got one quick question for either you or Dr. Whirling. You'd said that a couple of the cases where cleanup wasn't quite finished yet was due to manure. As a layman, I would just be interested to know the difference between how you've had to handle the ducks with the slurry versus the other birds that have got more of a dry litter that you're trying to dispose of.
I'm going to defer to the slurry queen.
So you have to pick that question up. No, I knew that would pique your interest, David, because we think about that with swine manure, right, and it being more of a liquid component. So yeah, we have, Dr. Cooper mentioned, we've had to be creative in our manure disposal, especially as it relates to the duck manure, which is more of a slurry and more of a liquid than dry litter would be like in an egg layer facility. Though that being said, there's plenty of litter and shavings combination that also occurs in some of those production types. And so we've had every single type of manure you could imagine on the same site that we've had to deal with, as well as, more production types that have more of a specific type, so, of manure. So, some of the things that we've worked on, we did a lit review and did some research from what is out there, not like field research, but research that individuals have done to see what the viability of AI virus is in duck slurry specifically, and tried to put that science to work and to do some treatments of that slurry. So things like a viral inactivation step and do pH alteration. So we're not necessarily removing virus, right, from that manure, but we are providing some sort of treatment to hopefully inactivate it based on pH alteration of the material as a whole. So we've worked on that. Most of that has been through changing that pH to a more basic component, so that any AI virus that would be in there would be inactivated by a basic pH. So that being said, that has some resource limitations, so we've also had to even segment it out with how much we ask to do a pH alteration. So if you think about the amount of manure that you might have to alter, and the amount of, let's say, caustic soda you have to put in something to actually have any kind of impact on the pH of that, slurry. So we've also been creative in making sure that we can segment out the high-risk manure from what we would consider low or nominal risk manure, and treat those statuses of manure differently. There's a lot of nuance into it, so I'll try not to bore you all with my dissertation on manure management. I have spent way more time talking about and thinking about manure than I ever thought possible. But short answer to your question, and we can talk more if you have more questions, is trying to provide some sort of viral inactivation step, both for liquid manure, but then also we've done that for dry litter as well, and do a pH alteration surface treatment, especially if we're able to tell recently added manure from, previously either stacked manure or manure from previous flocks and that type of thing. So the answer to your question definitely depends on all of the components of that manure, how old the manure is, that risk status that we can classify that manure as, if it's been recently added to, if it's been undisturbed for, weeks, months, years, depending on the production type and what's normal for their normal litter and manure cleanouts. We have also been able to do some just quarantine of that manure. So some of these sites have like outdoor lagoons or an outdoor cistern. We've been able to just have those be quarantined for 120 days. So they cannot pump that out, has to stay there. But there's also, science from literature that says that 120 days, AI shouldn't be able to survive in manure for longer than that. So we've done a combination of all of that to try to find a solution for a lot of these manure issues. And we are still working through a couple that have been particularly challenging too, because it also depends on the land that's available on site for some of like the dry litter that we need to think about, getting disposed of if they can't be, some of it has been incorporated into the landfill disposal, but if that's not an option based on certain limitations that exist, trying to find land either on site or in another location to be able to effectively kind of stack that manure, and we can make sure that we're not going to be adding risk to anyone else in the community. So it's a loaded question, but thank you for it.
We will accept any novel ideas
Yes,
on manure
absolutely.
management, because
I am very open to workshopping these ideas because
outside of turkeys, really, most other species, it very quickly becomes a manure issue, right? Just due to pure volume or the physical characteristics of it, right? And so, plenty of heartache and heartburn over manure, especially in northern Indiana, where, like Dr. Whirling said, we are trying to weave it in between farms that are already pretty close to each other in proximity, which I think also makes that incident in northern Indiana pretty unique, right? This is one of the most dense poultry areas in the entire country, right? So even compared to other parts of the state, right? Southwest Indiana, East Central Indiana, we're looking at around 5 times the poultry density in northern Indiana than those two areas. So it's really unlike any other part of the US. And we also like to remind folks that in 2025, we did keep 93% of our flocks negative for influenza throughout the year. So while it seems like we're talking about a lot of birds and a lot of farms that are being impacted, which is true, we have a lot more farms and a lot more birds that have remained healthy throughout the state. So just a little perspective as, you know, we can quickly get into the doom and gloom of the life we're living every day and trying to respond to this incident, but taking a step back and recognizing that our poultry producers are really working day in and day out to safeguard their birds and trying to utilizing all the tools possible to keep it off their site. So it's like Dr. Cooper has a visual.
Well, you were mentioning density, and this is a slide that I meant to include, again, a Dr. Kopp slide. So we were comparing, or he was comparing our spring outbreak essentially of 2025 to what we've done since October. And so the image on the left is the most dense infected zone that we've had up north. So the infected zone, 1.86 miles. In the spring, our most dense one had 6 premises, which is still considered quite dense. I mean, USDA very much sees any farm within the infected zone of being a very high risk. And so, you know, within a mile, oftentimes there is, you know, in many areas of the state or the country, there's only, you know, one other farm or no other farms. Up north, our densest one had 52 premises. And then in the whole control area in the spring, the most dense we had was 50 prems. And since the fall, our most dense circle had 293. And remember, we have, you know, up to 80 of these circles early on at one time. We only have, I think, maybe 17 or 20 or whatever now. But yeah, 293 premises within and commercial prem. So that's not even including backyard, which in those communities in northern Indiana, if you're not raising commercial poultry, you probably have a backyard flock. So these dots are just representing commercial prems, duck, broiler, or layer premises up in that area. So just an extraordinary density. You know, I was talking to one of the veterinarians with the Illinois Department of Agriculture, and she was talking about a couple of their turkey cases that occurred in Southeast Illinois this past year. And she was saying or this spring, she was saying how, gosh, we were at one farm and you could see the next farm. I was like, you can see like a dozen farms from all of these farms in northern Indiana. Some of them you can literally throw the rock at. So just tremendous density.
And just a point of clarification on that right map there's not a magical halo around that. The mapping software gives up after 250 farms. So there is plenty that go to the full border of that green line. It just stops at 250. So yeah, it's dense. And we know which prims are our most dense prims around them. We've not, knock on wood, found that prim yet, but we know where it is. So there is more dense than that.
Yeah. Again, thank you, Dr. Cooper, and all the avian poultry staff and everyone else. With that, Denise has told me that lunch is here. I think we have Indiana corn and soybean, or Indiana soybean and corn to thank for that. Let's see. It's my phone shows 12:05. Let's try and eat and reconvene, and I'll turn the mic back on at 12:40. And with Dr. Sir presenting at that point. All right. For those of you that are joining us online, you've got a few minutes to get back to your day now. Turn the mic back on. We'll reconvene, and we'll have Dr. Surd give us the report for the meat and poultry division.
Great, thank you. Thank you for the board for letting me come speak with you today. In my report, I said we had no new plants this quarter. That was going to be I guess a record for me since I started here 12 years ago. Never reported no new plants in the quarter, but last week we were really busy. We had 2 new plants during the program. Right under the gun there. Some highlights from this past quarter. Dr. Swikowski and I participated in a food safety working group with the State Health Department, the Indiana Egg Board, State Chemist's Office, and others to discuss new legislation that is coming out. Jeannie Noble, one of our compliance officers / auditor, EIO, attended the Indiana Meat Packers and Processors Association conference this year, and he was at our booth at the trade show and was there to answer questions, and loved meeting everybody. Meat and Poultry Inspection had 2 recalls this last quarter in some of our plants. These were wrapped up very quickly and efficiently, without any repercussions. We had 1 retirement this quarter. Last quarter we had several retirements, but we have hired 6 new inspectors and 1 new EIO since the last quarter. So this quarter we've been busy training inspectors. We still are covering some of the cooperative interstate shipment plants in the west central part of Indiana until we can get some of our new inspectors to take the inspection methods course so that they can inspect in these plants. But they're doing well, and we hope to have them by next quarter. Some of them having completed that course and being able to be in the CIS plants. We currently have 26 CIS plants. We did lose a couple last quarter, reported because they wanted to be able to export out of the country. So, but interesting fact, over half of our plants that process only under inspection are now part of the CIS program. And we currently have 8 CIS plants that both slaughter and process under CIS. This quarter, we received it's kind of an update since the report came out, but as far as compliance is concerned, they were very busy too. They received and investigated 13 consumer complaints throughout the state. They conducted 35 surveillances, 23 industry community liaison activities, 2 state recall effectiveness checks, and did find 4 violations, issued 4 letters of warning, and 2 verbal warnings. And of course, they're out there educating everybody as one of their daily responsibilities. Facilities, we've got a total of 83 official establishments, which is a little different because we had those 2 plants join. We have 3 limited permit retail HRI facilities, which are exempt poultry facilities, and then 54 custom exempt only establishments for a total of 140 program facilities. We currently have 2 open inspector positions. The one in the south area that I reported, we have filled that, and he actually started yesterday, so he's in the office today. We still have 1 that's the final approvals downtown for the west central area, and then 1 position posted yesterday in the northeast area. Our current staff consists of 41 inspectors, 7 supervisors, 2 EIAOs, 1 compliance officer, and 1 EIAO / compliance officer. He does kind of half his time as compliance and half as an auditor, and then 3 central office staff for a total of 55. Looking ahead, Dr. Swikowski and I will be meeting with Robert Bain, who is Deputy Administrator FSIS, on April 22nd, as well as Gary and Dr. Shipman, We were asked to join by the Indiana State Department of Ag to join in discussions about how to export or any exporting opportunities for our CIS plans. We're very excited about this. Dr. Swikowski and I will also attend the Association of State Meat Inspection Directors meeting in Iowa in May. Our trainings with the EIOs will continue this year on a quarterly basis. Dr. Renee will continue her extensive trainings for the new inspectors, which we have many of right now. We are expecting 2 new facilities to join the program again. And we actually have 3 plants almost ready to go for joining the CIS program. So I did change that number in there too, because we've had a couple others come along fairly quickly and are almost ready to join the CIS program. We have about 5 other facilities working towards joining the CIS program. This next year, maybe after this next quarter. But we also will continue to meet monthly with the Indiana Meat Packers and Processors Association and the State Department of Agriculture to help support new and existing plants. And we also have a meeting this week with the Department of Ag, hoping to discuss new regulations for the Made in USA labeling claims and how this can affect Indiana grown labels on some of our meat and poultry, expected meat and poultry labels. Happy to answer any questions.
Any questions for Dr. Sir? I guess your last point about how that would work with the Indiana Grown program, what are your initial thoughts?
Yes, thank you. Right now, we're being told by FSIS that Indiana Grown is considered a claim. And they are saying that in order to put a claim like made in Indiana, the animal has to be born, raised, slaughtered, processed, all in Indiana, and you have to be able to substantiate that. Those are not necessarily the requirements for the Indiana Grown, because that's it's not as stringent for that, and it is an organization rather than a claim, we feel. But they are viewing that. Now, they have told the Department of Ag a different story. They have said that they would be overlooking those regulations.
We're talking to the Department of Ag about that, because it's not just Indiana, it's got these other programs across the country. So even this morning, we were had further communications about it, and so NASDA is getting a message, and we're getting a message. And how these new rules will impact all these programs, whether it's Indiana Grown or Kentucky Proud or anything else out there. So we're sorting through that. More details soon.
This isn't USDA trying to push USA
new rule
with all those.
Yes.
Yeah, it's the new, how those new rules about made in the USA essentially are going to be applied is what its impact was. Interpretation of how that applies to these Indiana or these state designated programs. Yeah, it's not just born, raised, and slaughtered, it's also all the ingredients have to be
Other than spices and casings, as long as they are just shipped out of the country for cleaning and then come back.
There's a lot of details.
But you can specify, processed in Indiana or raised in Indiana if they were just raised here. So another option. We're hoping to get that released for the. We're trying to help get that Indiana Grown from being considered a claim or an organization.
All right. Good. Any other questions? All right. Thank you, Dr. Sir. All right. Moving on to Dairy Division. I've heard that Patrick's having to help with his father who's having surgery today, so Amy is gonna be
I'm gonna give a
filling
report
in.
today, and it's a good example of how the dairy department works, or dairy division within our agency. When someone can't, someone else will. And that's just kind of the way we operate. This is actually pretty cool. Patrick put this together, then of course I had to add a few things that we'll get to in a minute, but this first quarter we had 15 state surveys, 6 BTUs, 3 single service plants, and some plants. Average sanitation scores were 90.2. Takes in, basically the way I always think of it, 90's an A and 89's an F. There's no B, C, D in between or anything. So everything has passed so far. There's on the single service, the average was 82.3, but on single service, they're done a little differently. So it takes an 80 to pass those. So all in all, our surveys are going well. I would expect in the next quarter, we'll probably have another good, at least 15 surveys to talk about. Some fast facts going on right now. There's a total of 658 total grade A dairy farms. 206 of those farms are organic farms. There are 12 of those that are goat farms. I take that back. There's 12 goat farms. Those are manufactured farms going for cheese, so they do not fall in the grade A category. 510 haulers on the books, 23 grade A dairy plants, 15 on-farm processors. We have 4 truck wash stations and 1 transfer station within the state. 37 farms with a total of 177 AMIs, or automatic milkers, robots as we all call them. 12 direct load farms, 15 manufactured grade farms, 513 trucks hauling the milk out of Indiana right now. 29 manufactured grade plants, 16 single service manufacturers, and 9 distributors. Now, some things he left off here that I wanted to bring up. Right now, we have a farm that is being built that is putting in 20 DeLay robots, and they're going to milk about 1,300 cows. Last week, we just approved our very first 120 cow rotary in the state. We've got rotaries that are 100 cow, but 120 is new to us. And there's at least three more looking at being built very soon.
How many cows will 120 cows?
Somewhere in that 7,000 range. So when we looked at that statistic, and we ranked 15th in the nation, I'm hoping this is a trend, because not only are we seeing that, but I'm also seeing the 50 cow Amish farms, or the smaller farms, still being built, especially up in that northeast area. But I'm really cheering on that fact that I think we're going to get to 14, maybe even 13. That's my goal anyway. I'm not building a dairy, but that's my goal. We've also got a lot of places, some of the big farms, taking out bulk tanks and putting in 15 to 30,000 gallon silos for milk. Let's see, a lot of innovation going on as far as old recording charts. We're moving to electronic recording charts. So a lot of innovation going on in dairy right now. A lot of growth going on in Indiana dairy. And I'm really proud of that, because our dairies are good. Our dairies are very good. The working relationship between all of us out there with the dairymen is the best in 30 years I've ever seen it. So a couple other things looking ahead. We're going to be sending some staff members to some FDA training courses. There's 2 that are going to go to the farm sanitation and inspection course in Iowa, and 2 will be attending the milk plant sanitation and inspection. I think that's in Iowa also. It's very, very good training. We try to at some point get everybody through those classes. Partnerships and outreach. James Larison, our Chief Lab Evaluation Officer, he's been working with some other states on split samples. Let's see. The dairy team is kind of backup for any high path cases. We're doing everything from the environmental sampling to Dean Adams is an SME and he's spent a lot of time composting, and working sites. We have other milk inspectors that are just taking their time to run samples and corresponding to get halfway to 80 DL and pass them off. So we just consider ourselves available if at all possible, and so far it's worked out extremely well. Us doing that. Nathan Campbell did have he's our assistant or our deputy director. He did have a meeting with IDP, Indiana Dairy Producers, and they had a lot of questions and we work well with them. And they had a lot of questions about regulatory and so forth that Nathan was able to educate them on. And then last, Patrick, Nathan Campbell, Tina Zering, our office lady that runs the dairy, regardless if we have a director or not. Tina runs everything for us. And Sarah Horning and Denise were able to attend the Indiana Milk Quality Conference a month ago and gave a lot of updates on BOA and what we do and what we are doing. And that's really about it.
Okay.
Does anyone have any questions for me?
Well, Indiana Dairies and the dairy division had a lot of things, they're proud of, it's not just fluid milk. You got the East ice cream plant they have to do, the Ready Whip topping plant, and then you got Mike McCluskey, veterinarian, and his wife built Fairlife Milk.
I always tell people, imagine a world without dairy products.
That's right.
What would
So,
you eat?
we got a lot of front namers besides being, it's 15th. We got a lot of firsts there. And the Nestle's plant?
Yeah, I didn't expect Indiana to grow quite like it has, but we're proud of that. And we have a great team that, like I say, works together and we continue to just move up in the ranks. So thank you.
No, Amy, thank you for filling in for Patrick.
No
and
problem.
thank you from earlier today for all the years of service you put in for both.
Thanks for BOA to keep me around all those years.
All right, moving on down the list, we'll move on to Dr. Shipman with the state veterinarian's report.
Sure, just want to highlight two pieces from my report that was provided. First, just an update that the high path and dairy surveillance continues across the state of Indiana, averaging more than 250 tankers each month. So this is due to high path being found in several states across the country. We do see this kind of trickling out, at least nationally, with only a handful of states currently classified as affected. So that's Texas, Idaho, and California. They were also the states that were most significantly impacted by this virus in dairy and cattle. For our new board members, just as a reminder, we do not take the same action as we do for birds. High path and dairy cattle, the cows will generally get a little ill, decrease their milk production, and then recover within 2 to 3 weeks, and a little longer to get back into their milk supply. So the National Milk Testing Strategy is to take a comprehensive look of the states and surveil their milk supply to have a better understanding of where this virus may be, because some cows aren't actually becoming clinical either. So trying to piece that all together. So we are on our 9th round of National Milk Testing Supply tanker testing. We have not had a detection in our Indiana milk supply as of yet. We are currently working with USDA to reevaluate our testing strategy and potentially move to a silo testing. So that would be, instead of testing the tankers before they dump into the silo, testing the silos after the tankers are dumped in. We've considered that in the past. It would be significantly less samples for us to help coordinate and have the Indiana ADDL run. But there is some pieces to that. The paperwork around that gets a little bit more challenging if we were to have a positive detection at the silo level, and then kind of unraveling that trace investigation would take some time. So we're actively in those conversations around high path and dairy and the National Milk Testing Strategy. And it does seem that hopefully that is maybe coming to an end, big picture. Both the testing strategy as well as just the activity in that with that virus in the dairy industry. So the challenge with that virus, when the cows kind of go out of milk, they're going from 100 pounds a day to 0 within about 24 to 48 hours. So it's pretty peculiar for this, generally what we consider a respiratory virus, influenza, having a predilection for mammary tissue in dairy cattle. So when they look at those clinical cattle, they can find this virus in the udder, mammary tissue, the milk, but really struggle to find this virus anywhere else in the cow. They can occasionally find it in the urine, occasionally find it in the respiratory tract, but not nearly to the extent that we would see in other species. So a very peculiar presentation of the virus, which caught, I would say, the country and probably the world off guard. We generally see once it enters a community, or what we have seen, once it enters a community, it spreads rapidly. So I think between 70 and 80% of California's dairy industry was impacted by this virus. The other challenge we have is since they would have this virus that's pretty significant, pretty high levels of virus in these animals. So the likelihood increases of it spilling over. And we did see in several states where it would spill over from cattle back into poultry. And when it spills back over into poultry from dairy cattle, it is still highly pathogenic and the birds succumb to the virus rapidly. So just a kind of a note there that we are actively looking at what that surveillance strategy looks like, and maybe updating it here in the coming months to kind of right size it to the current incident that we're experiencing across the country. Any questions on high pathogen dairy before I go to the next one?
So changing to the silo testing, so sensitivity of the test is not going to be compromised.
There's a lot of conversations around that. NVSL says no. And that's all we have to go off. They've apparently evaluated that. It makes us a little uneasy, right? Because these silos are quite significantly larger than a tanker. However, they believe that they can find it. The other challenge that we have with this virus in milk, it is quite elusive. It's a different in the surveillance and in the testing pathways, trying to nail down this virus in the milk. There is some antibody, we believe antibody interaction that you can, and we saw this across the country where you would have an initial positive, the milk would be initially positive, it goes out to NVSL for confirmation, and NVSL can't confirm it because something happened, and we believe antibodies played a role into making it where that PCR test will pick it back up and confirm out that result. And we don't know if that's because the cows are recovering, right? And so if they are recovering, they should be producing antibodies to it. So if the antibodies are truly effective, they will be interacting, right, with the antigen itself. But there's a lot of unknown in one piece. But what we have seen is just time itself is an interesting variable to see how this pathogen is able to be detected or not, and kind of the stability of it. So a lot of states are doing silo testing. So I think has some value. But again, the biggest reluctance for us is how the process, we want to make sure we're not overburdening the milk processors, and how they already keep their records is at the tanker level, not necessarily at the silo level. So if we work, which is all fine and dandy until there's a non-negative or a positive, and then you have to start unraveling that paperwork in a way that they can do, it's just not their natural way of collecting that information. So there's I would say a lot of nuance to how this virus has presented. So next I'll jump to New World screw worm, one of our favorite topics. So have the information provided there. Again, FDA is conditionally approving additional drugs as well as emergency use authorization additional. drugs for both small animal, companion animal, and livestock. The thing to keep in mind with these, especially in livestock, is going to be the withdrawal period. So with, we got updates, I believe last week, of a dog being found to be infested in Mexico and within 90 miles of the Texas border. So obviously that's of concern. We continue to see those detections in that between 200 and 90-mile range of the Texas border there. So obviously that is of pretty high concern. The USDA estimates if we were to have an infestation of New World screwworm in the United States, it would impact the U.S. livestock industry to the tune of about $100 billion. So that's something that obviously we want to be mindful of and be as proactive as possible in ensuring that it's not going to enter the country. Secretary Rollins at USDA has started conversations around the potential for opening up the southern border to allow Mexican cattle back into the U.S. That would be likely done at the furthest west, the westerly port, which is the furthest away from where a lot of the active infestations are. We import a lot of Mexican cattle into the U.S. To feed out and eventually slaughter. Those borders have been closed for a while now for cattle and horses, and so they're at least initiating the conversations. They've got they're gaining confidence in the data that is being provided by Senacica, the USDA equivalent in Mexico, so that they can make an informed decision, a risk-based decision, potentially opening a southern border port. So that's another piece that to that puzzle that they want to be mindful of. They are currently working to, they may have broken ground on a new sterile fly breeding facility in Texas. That Texas facility is expected to be a $750 million facility. Once it's just, built in that full capacity, it would be producing 300 million flies a week to be airily dispersed across Mexico, Central America, and even potentially the United States. So also within the past week, USDA released their updated playbook. That's kind of similar. It's their kind of overarching strategy on what the USDA, US as a whole would do to respond to New World screwworm if there was an infestation in the country. So we are actively reviewing that to determine what potential interstate processes would need to be put in place to ensure that we do not have an introduction of the fly into Indiana. We are unlikely to have a direct, right? I mean, the fly getting up to us naturally, it will likely move on an animal up to us if we were to have an infestation at some point. But one of the challenges that we're kind of starting to let folks know that we'll have to figure out ways to overcome this, and it's consistent in their current playbook, is the expectation from USDA is that all livestock species within a 20 kilometers to 12 miles of an infestation are quarantined, right? So we talk about 10 kilometer, 6.2 mile control areas. They call these infestation zones up to 20 kilometers. So fortunately, they have carved out companion animals, because at some point they were in, and that'd be quarantining all companion animal sites, which I don't know how to do. But those are the conversations we are having on what does that realistically look like? What does that permanent movement look like? What does all of those parts and pieces look like to do that? And I think at the end of the day, where we kind of landed, we've had the conversations about bird flu, but really for almost every state in the country, we don't have the people to do 2 animal health emergencies at once, right? Or at least do them well. We are doing one, and I would say we're doing it well, but we're trying, we've tried to do lots of overtime. With lots of overtime and a lot of folks that are really tired, right? And I know we're not alone in that a second animal health emergency, especially with something as novel as New World screwworm, would have a pretty significant and detrimental impact to the country as you just try to get everything spun up around it. We don't have the teams in place and just people to get that done. So just a conversation that we're continuing to have with folks across the state and USDA as that cautionary tale of something to be mindful of, because we have a lot of time, a lot of resources in something that we know, which is high path, but a lot of time and a lot of resources is something we don't know. It'd be similar to the conversations I had during lunch if it looked like ASF, right? Those kind of unprecedented detections. But this one is quite literally knocking on our door. So just want folks to be mindful of that. We are actively trying to plan for that in any piece of spare time we can find, so that we don't get caught flat-footed. But it is a challenge that I would say most states in the country are up against. So any questions on New World Screw?
They would lift the ban on the import cattle from Mexico. They just automatically treat them with Dectomax or something?
Yeah, so basically what they've kind of started to propose is, a pre-treatment, as well as I think a pre-presentation inspection, and then they'd be presented to USDA for inspection. So I think Mexico would have to do an inspection prior to USDA doing an inspection. But I would guess that they're going to have to be a stipulation of their movement would be treating. Yeah. So they are seeing it, unfortunately, in young calves as well. So down to like 7 days old, if not younger. Generally umbilical wounds, but also around processing, so castration, dehorning, anytime you're creating that wound, you're really opening up the risk for this fly. So the other challenge that we have to be mindful of is this is going to be an all hands on deck, because it's not unique to just to animals. It impacts humans too. So Central America and Mexico have reported over 1,000 human cases of New World screw as well. So it would be a true One Health initiative. So wildlife health, animal health, and human health if we were to have an incursion in the US. So another kind of unprecedented piece that.
So quit complaining about beef prices and just be happy.
And we've seen those kind of implications of that, right? So.
I was gonna say, is it political pressure that are wanting to let the Mexican cattle in because of beef prices? Is that the reason?
They seem to be quite attuned to some of the political pressures, both I would say on the egg side as well as the beef side. We hear from DC, I wouldn't say often, but more than I'd like to hear from them about just concerns, and wanting awareness purposes of what's happening. That's on the egg side, and so we just have those conversations. But I would guess that there is some they're trying to figure out how best to pull which lever, right? And so,
seems like quite a risk.
Yes. So.
Then the sterile fly, that's just to outcompete.
So these flies only breed once, right? So it'd be an unsuccessful mating, and then we would over a period of time decrease the population. Joint venture between the U.S. and Panama is where the sterile fly breeding facility currently is. That's 100 million flies a week. They're working to stand one up and maybe in production in Mexico. That I think is, maybe 50 million, 75, a number of millions of flies a week, in which they converted a fruit fly facility over to a New World screwworm facility. But all of those have to be aerially dispersed. So they're flying up from Panama up to Mexico. They're now even dispersing some of those flies into Texas because we are finding it so close on the southern side in Mexico. The unique thing about these flies, yes, they are sterile. They also, in that process, have a dye placed in them. So under a microscope for sure, but most of the time under the naked eye, you can grossly look at this fly and tell, because I think it fluorescence green. So they are doing a ton of trapping of flies on the US side to continue to demonstrate the flies not here, but they've started to kind of flag that, okay, we may trap New World screwworm flies in the US, but let's make sure, because it's likely a sterile fly. which means everything's working the way it should. So just another piece of trying to sort out those logistics. And up until I think 2023, this fly was held south of Panama, right? That's why the facility's built in Panama. Panama is the most narrow part of Central America in the isthmus there. And so geographically, they only had to defend a biological barrier. That's the narrowest point in which they had to do that. And so, but for one reason or the next, in 2023, 2024, the screwworm fly population was able to overcome that barrier and has since worked its way north. I think the last time it was in, I'll say mainland US, was in the 70s in Texas, but more recently it was in the Florida Keys and the Key deer specifically, and they were able to push that out through sterile flies as well. So that is the primary tool is sterile flies. The secondary tool is prevention and quick treatment if there are cases. And then the third tool is just restricted movement, to just don't move. Because what they're typically seeing in Mexico and really throughout Central America is kind of the leapfrogging. And it's on animals, right? It's not that the fly is just moving that fast, but it's on an animal. That animal moves as it's heading to market in whatever direction it's going. And then we see those detections down the road. So 2,000.
2,000 eggs a lot.
Yeah, I think two. Huh?
The female, what's that?
Yeah, I think the female lays around 2,000 eggs. So I mean, like, right, you really want that to be an unsuccessful mating.
Anything else, Dr. Shipman?
That is all.
Any questions for Dr. Shipman from his report? All right, moving on to other business. I'm going to exert a little bit of chairman's prerogative here, and I'm going to put something on that wasn't on there. Dr. Whirling recently came back from the Agri Institute class trip to Africa, and I would love for her to share with us for just a few moments about what she saw in both Ghana and Kenya when she was over there.
Yeah, thank you for bringing that up. I meant to actually tell you during my time to speak, and I totally just forgot to mention it, so thank you. Yeah, so I had the opportunity over the past 2 years to participate in the Indiana Agri Institute's Ag Leadership Program. And so for the past 2 years, we've been meeting about every other month, mostly within Indiana, to tour different Indiana agriculture and related or associated industries and learn just more about Indiana agriculture as a whole. So not just on the animal health side, but row crop. We went down to the locks and keys, so also learning about like transportation of agricultural products on the Ohio River. So things that you don't always think about, or at least I don't always think about as it relates to agriculture, but had the opportunity to do that. And then after the 2 years, it kind of culminated, I guess, in a 2-week international experience, which is what David was referring to, and had the opportunity to spend 2 weeks in Africa, 1 week in Ghana and 1 week in Kenya, from February 15th through March 1st. So I basically missed all of February, it felt like, in Indiana, which I'm not complaining about because it was quite, weather was quite different in Africa than here. Yeah, so had the opportunity to experience agriculture as it is, as it exists in other countries, specifically in Ghana and Kenya. We had the opportunity to experience the culture, everything from what we would consider like small subsistence farming, but is their main way of producing agricultural commodities, raising livestock, raising produce. So they grow a lot of like mangoes and pineapple and what you would expect of a more tropical climate in both Ghana, mostly Ghana is where we saw a lot of produce production, but then also in Kenya. So had the chance to also visit the U.S. Embassy in those countries, which was also pretty cool. Get a chance to hear from them as to their role, not just in agriculture, but across the board as U.S. citizens serving in a U.S. embassy in Ghana and Kenya. And then last but not least, had the opportunity to spend some time on safari in Kenya, which thankfully, I was like, please tell me we're not going to go to can get not at least be on one safari. But not only did I get to do one safari, I got to do several, which I'm very grateful for. So we had the opportunity to spend time at the Masai Mara nature preserve, I guess, which isn't the Serengeti, but runs like parallel to it. So basically, you know, if we were just a little bit further, we would have been on the Serengeti. So had the chance to literally look out the window and see every like African wildlife animal you could imagine, which was really neat. And be within like touching distance of a few of them, which was a little terrifying, but I'm grateful for that experience. So we had the chance to learn more about conservation practices there as it relates to their wildlife and just the amount of cultural identity that Kenyans find in their wildlife species, which I thought was just really cool to see. Like they really do care about preserving the animals that live there, not from an agricultural standpoint really, but from this is a part of our identity and culture as Kenyans, that there are literally elephants right over here, right? And that type of thing. So had the chance to see that, had the chance to do a boat safari too, so got up close and personal with some hippos. That was a little terrifying, but really, really cool experience to be able to experience that. And then also had the opportunity to do a Hopelin safari over in the Savannah. So once in a lifetime experience that I will never forget. And I'm very grateful that BOA gave me the time to participate in the program over the past 2 years. And then everyone was so supportive of me being gone for 2 weeks in the height of High Path AI. So thank you to the team, because I know I left you in the lurch for 2 weeks. Because one, the time zone was different, so I couldn't even try to keep up if I wanted to. And then two, I didn't have service. So there were moments where I just was completely out of touch with reality. So yeah, thanks for the opportunity to address the group and provide a little snapshot of what we had the opportunity to experience. So for those that aren't familiar with the program, it was essentially 28 like agricultural professionals, farmers, you know, individuals that are in allied industries to of an agricultural standpoint. We also had an individual that's with the Nature Conservancy, so also the conservation interface between agriculture and conservation. So 28 of us, and then Beth took off and went to Africa for 2 weeks. And 2 weeks later, 4 time zones, 3 continents, we're back and happy to be able to have had an amazing experience and the opportunity to take those learnings and bring them back here and just reflect on, you know, the similarities, the differences, but then at the end of the day, like agriculture is what has brought us all together. So, so yeah, thank you for the opportunity. If anyone has questions, I'm happy to talk in more detail. 2 weeks was really awesome, lots of experiences, so I don't want to just drone on, but I'm happy to talk after the meeting if you have other questions or want to know any other things that we had the opportunity to experience while we were here. Yeah, thank you.
Thank you for indulging us.
No, absolutely.
Okay. So in the interest of everybody else's time, we're going to move on to some of our last orders of business. With the new appointments, we have lost Dr. Bill Doig as our chairman. So we're going to need to elect a new chairman for the board to run our meetings. We also need to elect a new vice chair, and then also a hearing officer, which in the case of people coming to BOA and wanting to have a hearing on any regulatory action that had been taken against them, that person would need to preside over that. In the past, Dr. Doig was our hearing officer, if I'm remembering correctly. So with that, I will open the nominations for chairman. And those of you that are online, don't feel bashful if you need to jump in as well.
Move to nominate David Harden.
All right, Virgil has nominated David Harden.
Second.
Yeah. Do I have any other nominations for chairman? I guess I would entertain a motion for nominations for chairman to be closed.
And so moved to close the nominations.
Okay. Second. Can we just take this by, no, I guess we can't do it by acclamation because wrong line. All right. Gary, go ahead.
All right, so the first vote would be to close nominations. Dr. Armstrong. Larry Hopkins.
Yes.
Virgil Bremer.
Yes.
Dr. Hall.
Yes.
Dave Harden.
Yes.
Ty Howard.
Yes.
Dr. Ragland.
Yes.
Brad Fisher. Yes. And Dr. Hafner.
Yes.
Did I say Dr. Armstrong? I don't recall. Did I? Yes, just in your response.
Okay, the next question will be on vote for David Harden for chairman.
Yes, Dr. Armstrong. Larry Hopkins.
Yes.
Virgil Bremer.
Yes.
Dr. Hall.
Yes.
Dave Harden.
Abstain.
Dr. Ragland.
Yes.
Brad Fisher.
Yes.
Dr. Hafner.
Yes.
Okay.
Yeah, call me that.
I'm sorry, Ty.
Okay.
Ty Harder. You're on the list.
All right, next I'll open up nominations for the position for vice chairman, who in the instance that I am not present or am otherwise incapacitated, be in charge of running the meetings and exercising the duties of the chair. This ought to happen to me. Again, for those out there in the virtual world, don't hesitate to throw out names.
Move to nominate Ty Harwiger.
I second.
All right, it's any other names for vice chair? All right, in that case, I'll entertain a motion for nominations to be closed for vice chair.
So moved.
Do I have a second?
Second.
Thank you, Dr. Hall. All right, go ahead and have a vote on the question of closing nominations.
Dr. Armstrong. Larry Hopkins.
Yes.
Virgil Bremer.
Yes.
Dr. Hall.
Yes.
Dave Harden.
Yes.
Ty Howard.
Yes.
Dr. Ragland.
Yes.
Brad Fisher.
Yes.
And Dr. Hafner.
Yes.
Okay, now the nominations are officially closed. We'll have the vote on Ty Harwiger for vice chair.
Dr. Armstrong. Larry Hopkins.
Yes.
Virgil Bremer.
Yes.
Dr. Hall.
Yes.
Dave Harden.
Yes.
Ty Howard. Dr. Ragland.
Yes.
Brad Fisher.
Yes.
And Dr. Hafner.
Yes.
Okay. I will ask a question of our chief of staff. Does the hearing officer need to be DVM?
It could be any member of the board. And just an explanation on what this is, the agency takes enforcement action or issues an order. there's an opportunity to appeal that, and so someone may ask for a hearing or appeal that. Almost all the time, we can resolve those with a discussion, usually meeting with the state veterinarian or some other kind of action. And so I don't remember the last time we actually had a hearing. It's been a while. But what that allows the board to do would be to have that hearing with one of the members, the hearing officer presiding over it, rather than doing it during a board meeting. Because otherwise, you'd have the hearing during a board meeting and everybody would be here, and it would basically potentially could take a whole day to have a hearing, and then all the members would have to be there for that. So that's the purpose of the hearing officer. The hearing officer could preside over that hearing, collect all the information, and then make our recommendation to the board for the final action. So that's why we have a hearing officer, just in case you have a hearing.
Okay. That needs to be in person, I take it.
Not necessarily. I mean, not necessarily these days. Yeah. We haven't had I know the Board of Veterinary Medicine, they have more hearings, and they have some people, depending on circumstances, that can participate. In that the board itself is present physically, but some of the participants can be virtual.
Yeah, I was trying to think the last time this board, I think it's been over a decade.
That's been a while. Again, you can have somebody who would request a hearing, and so you start down that process, and so that can involve the hearing officer to essentially sign some papers or that sort of thing. But usually, what usually happens is they just want to talk to somebody, and so we'll schedule a meeting and say, "Veterinarian, we'll sit down, talk it out, and figure out how to resolve it before it actually gets to the hearing."
Gary, thank you for that description, historical context. All right, so with that, I'll open up the floor for nominations for the hearing officer for the Board of Animal Health.
I'll nominate myself.
Dr. Ragland is self-nominated. Do I hear a second?
Second.
All right. Any other nominations for the hearing officer? I would take a motion to close nominations.
I move to close nominations.
Second? Second. Dr. Hall. All right.
Okay, the first vote is on the motion to close nominations for the hearing officer role. Dr. Armstrong, Larry Hopkins.
Yes.
Virgil Bremer.
Yes.
Dr. Hall.
Yes.
Dave Harden.
Yes.
Ty Harwiger.
Yes.
Dr. Ragland.
Yes.
Brad Fisher.
Yes.
And Dr. Halfman.
Yes.
Okay, now have a vote on electing Dr. Ragland as the board's hearing officer.
Larry Hopkins.
Yes.
Virgil Bremer.
Yes.
Dr. Hall.
Yes.
Dave Harden.
Yes.
Ty Harwiger.
Yes.
Dr. Ragland.
Yes.
Brad Fisher.
Yes.
Dr. Halfman.
Yes.
All right, well, congratulations to all the newly elected officers. I guess this is the point where I ask if there's anything else for the good of the order. Oh, sorry. You see, I'm trying to get out of here already. All right, the proposed date is Tuesday, July the 14th. Let everybody take a look at your calendars, see if that doesn't offer too many conflicts. That's a time of year when a lot of people are trying to take last vacations before the kids go back to school, and county fairs are also that time of year. All right, I don't see too much opposition to it, so we'll go ahead and pencil it in for 9:30 on the 14th of July. All right, now, Gary, I'll ask, there's anything else for the good of the order.
No, just the, for the new board members, keep an eye on your email. I know, gotten a couple emails. Like I said, I'll send you the ethics training. And also, our chief financial officer has sent you an email about some forms to fill out so we can reimburse you for travel, right, for meeting per diem. So when you get an opportunity to, you can fill those out and bring them back the next meeting, or you can send them in, or however you want to do that. We can make that happen.
Do I need to do any of this stuff?
Yeah, I'll get the schedule.
Okay, well, with that, call us adjourned.